بسم الله الرحمن الرحيم اللهم صل على سيدنا محمد وعلى آل سيدنا محمد. Welcome to the mental health post-conference training. This is my first time at AMGA, so it's an honor to be here during this time. My name is Dr. OMAR MAHMOOD. I'm a clinical psychologist, so just giving you an introduction of who I am, and we have some slides and discussions that we're going to present, but also it would be very helpful to hear your thoughts, your questions, your discussions throughout today.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you so much for joining us. My name is Dr. AWAAD, and I'll be co-facilitating this training today, inshallah, with Dr. Ahmed. And this focus today is really on really what your needs are related to mental health in your communities. Inshallah, we're going to do this workshop throughout the day in different modules and sections. And I'll be starting, inshallah, and then Dr. Ahmed will be back and forth. We'll be kind of sharing training within that. So I'll go ahead and get started. Bismillah ar-Rahman ar-Rahim. Wa sallallahu ala hadi Muhammad wa ala alihi wa sahbihi wa sallam ajma'in. When I speak about mental health, I'd like to really understand where the audience is coming from. And so inshallah, I'd like to first ask you a question and to ask what comes to your mind when you hear mental health and Islam. So this is a time for you to share, inshallah, your thoughts. I'll take a couple of ideas. Nice. So definitely something related to balance. I'd like to take us on a journey that all of you are well familiar with, and it's really starting with the Prophet Muhammad sallallahu alaihi wasallam. And for me, when I think about mental health, and this is kind of, I'm sure we'll both be sharing a little bit of our own journeys into the field. For me personally, I did not enter this field, did not assume that I would be entering this field. I was not interested in anything related to psychology or psychiatry. In fact, I had a lot of hesitation and a lot of concern about this field. And it was actually through my Sharia studies and my Deen studies and teaching in our community, halaqat, classes, and so on, that it became relatively clear that our community had mental health needs and that they were not being well addressed. It was actually my husband, akramahullah, who actually turned to me one day and said, "RANIA, I was planning to go into women's health," and he said, "Many good people can deliver babies safely, but we need people who are trained in the Deen to be able to take on the discussion of mental health." And so my journey was very much a roundabout journey into this field. And a lot of it, which I'm going to share with you today, some of the research that I've done over time in my lab, has to do specifically with where does Islam sort of fit in with mental health, or better, where does mental health actually fit in within Islam? And I'm starting here with this dua of the Prophet sallallahu alaihi wasallam, which, as you notice, is one of his adhkar sabah wal masa, if you're familiar with the morning and evening dhikr, and reminding everybody that Allah subhanahu wa ta'ala sent us the Prophet sallallahu alaihi wasallam, khayri khalqil kawn, right, the best of all of creation, but at the same time a human. He did not send to us an angel. He sent to us a human that had, of course, human emotions and difficulties at times. And as the most perfect of all of creation, he would still get up in the morning and say multiple adhkar and dua. This is one of them, and you're familiar with it. But if we just say the first part of this, Allahumma inni a'udhu bika min al-hammi wal hazan, and just stop right there for just a moment and think about how he sallallahu alaihi wasallam would ask Allah to protect him from grief and worry. And then when people have a hard time with this discussion, as I once did with mental health in Islam, we have to look straight back to the Prophet ﷺ and his sunnah and his practice, and also what he taught to the people around him, his sahaba. And what's very important in all the messages that we'll see, and we'll continue on a little bit more with his seerah, sallallahu alaihi wasallam, is that this was very much dealt with. It was not something that was denied nor something that was sort of brushed under the rug. It was very much prevalent and present in his community, sallallahu alaihi wasallam. And then from there, you see it was very much inspired the next generations, which we'll talk about as well, bi'idhnillah. And so here we start by saying that the Prophet Muhammad sallallahu alaihi wasallam and the other prophets mentioned in the Quran are not immune to psychological challenges. We are careful to not put modern clinical descriptors on any of the prophets because we don't have that knowledge. But we do know from the scholars of Sirah, for example, that there was an entire year of his life, which you know, called Aam al-Huzn. And in this year of sadness, or year of grief, year of sorrow, that the Sahaba around him were really worried about his well-being. So much so that he grieved so deeply that they were actually quite concerned about his well-being. And you may know the events that happened, of course, Aam al-Huzn. We won't go into an entire Sirah discussion at the moment, but you know that he lost his wife, Khadija radiallahu anha, and then his uncle, Abu Talib, and then the most difficult day of the Prophet's life, sallallahu alaihi wasallam, all within weeks of each other, that would be Ta'if. And then, of course, he has the Isra al-Mi'raj soon thereafter. But you see that these events happen back to back to back, all within weeks of each other. And the descriptor of Aam al-Huzn is something that's very prevalent in the Sirah, well known. And then I take a pause for a moment and think about how when we have members of our community or our families that go through loss or go through any sort of difficulty, and how we tell them, you're not allowed to grieve this long, or you need to snap out of it, or you need to not have such intense grief. And there's a sort of a shame or a judgment or a stigma that's put on to individuals that are going through a rough time. And I know this because this is the domain of the deen that many of us function in. But I also have learned, and I think it's important to share, that we all grieve differently. And grief and mental well-being looks differently for each person. I would also say something important here, is that I don't think that any of us would really dare say to the Prophet ﷺ or about him that he did not have sufficient enough iman when he was going through Aam al-Huzn. Nor would we say that he didn't pray enough during Aam al-Huzn. Nor would we say that he didn't have tawakkul or reliance on Allah subhanahu wa ta'ala. That often these are the same sentiments we say to members of our communities. I'm not here to shame us or to superimpose or kind of say any of these things. I'm just merely capturing what's often said in our communities, and how that narrative does need to be changed to something that's much more prophetic in nature. And it's not just the Prophet Muhammad sallallahu alaihi wasallam. You also have other prophets in the Quran. I'll mention Sayyidina Yaqub. Of course, the Surah of Yusuf is a beautiful surah in which there's an entire storyline going through the entire surah. And when you come to Sayyidina Yaqub, the way Allah subhanahu wa ta'ala decides to describe him and describe his grief in the Quran is very pointed. Allah subhanahu wa ta'ala does not use anything haphazardly. It's very specific and direct. And I ask you if you can tell me the verse of the Quran in which it very eloquently describes the level of his grief and manifestation of it. فَهُوَ كَظِيمٌ. Exactly. وَبِيَضَّتْ عَيْنَاهُ مِنَ الْحُزْنِ. It's really a powerful descriptor. Allah subhanahu wa ta'ala could have described him in any way. He could have told us what he looked like, what he did, but instead he very specifically described that his eyesight had gone white, as it's translated in English. And of course, as you know, some of the scholars of the Quran, of exegesis, will say that this is, some said blindness, but most said it was more of a haziness. And it was so intense until, of course, his eyesight came back literally decades later when he was reunited with his son Yusuf, alayhim as-salam. And when you think about this descriptor, how does somebody have their eyesight become white? How do you have something that's an emotional concern that turns physical? Literally a somatic or body-based response to intense grief. It means that he was crying consistently every day, every day, all the time. So much crying, so much crying, so much crying that literally his eyesight went white with grief. And this is interesting as well, because then we talk about what does crying mean? What does crying mean for a man? What does crying mean in cultures where we tell ourselves men don't cry? Or what are you, a girl? Or things of this nature, which unfortunately our cultural kind of filters into our concepts, which are not necessarily accurate, nor are they part of this tradition of ours. I'm not saying that we are to do anything else than what is told to us in the Sunnah, but I am pointing out that even the Quran, that Allah subhanahu wa ta'ala in the Quran describes how when somebody has such intense amounts of emotional outpour, it also affects their physical well-being. So far, so good? We okay? Tamam? And so, back to the Prophet sallallahu alaihi wasallam. And here, I want to point us out to some of the students, disciples of the Prophet sallallahu alaihi wasallam, his companions. And we have this really beautiful story where you have two of the brothers who are paired in Islam, Salman al-Farisi radiallahu anhu, and Abu Darda. And Abu Darda is very zealous, excited about things. And one day he tells his brother that I'm going to fast all day and not break my fast. And I'm going to pray all night and not go to sleep. And I don't need to get married. And his brother, Salman al-Farisi, responds to him and he says, your Lord has a right upon you, yourself or your body has a right upon you, and your family has a right upon you. So give each their right. إِنَّ لِرَبِّكَ عَلَيْكَ حَقًّا وَلِنَفْسِكَ عَلَيْكَ حَقًّا وَلِأَهْلِكَ عَلَيْكَ حَقًّا فَأَعْطِ كُلَّ ذِي حَقٍّ حَقًّا. The way we know this particular narration is because the story reaches the Prophet ﷺ. And when it reaches him, he says, Salman has spoken the truth. And when we think about the story, Salman on his own, radiallahu anhu, doesn't sort of come up with this on his own. He comes up with this because he's a student of the Prophet ﷺ. And the Prophet has taught them the concept of holistic well-being and balance. And so for him to be able to come up with this and kind of advise his brother, and also that the Prophet ﷺ himself hears it and says he has spoken the truth, tells us something related to holistic well-being, the importance of having everything in due measure. And so we'll see here then that really the takeaway message from a very short kind of encapsulation of the Prophet's life, sallallahu alaihi wasallam, his seerah, and also from the Sahaba around him, and then the next generations that were inspired by Islam, is a very holistic healing method. And this is not foreign to Islam. It's actually a trademark, literally, of Islam. And when we look then on well-being and how the early Muslims understood mental health, we understand that they prioritized it and gave it the same considerations as any other form of healthcare and well-being. For me personally, I'll take just a moment here and tell you about just my own journey in this story. This was very healing, to kind of come to some of these conclusions, things that we had learned all our life, they're part of our studies, but maybe drawing the connections or connecting the dots wasn't as easy. Certainly when I was growing up, there were no khutbahs or classes or anything from the minbar or from the leaders of our communities that talked directly about mental health in Islam. I didn't even know there was a connection. So much so that when I entered into the field and I was very skeptical of it, my earliest research was actually figuring out, well, what did the early predecessors say about mental health? And it was interesting because this is where I'll share with you some of the work over the course of today, inshallah. But I'll just in brief say, there was a time early on in my training, I trained at Stanford University, and as I was there, I pulled out literally at one point hundreds of manuscripts. And these are the early manuscripts, the turaf, like your yellowing pages. And thought to myself, well, if there's some discussion on mental health, it must be in the works of our early predecessors. And subhanAllah, what was really amazing from that, beyond the seerah of the Prophet ﷺ, I was looking for what came after that. And this is where we run across so many of the greats, the great minds, the great predecessors who really thought about theoretically what it meant to have well-being, holistic well-being. And I'll share some of that today, inshallah, because I think that turned a corner for me. And then also share their practical implementations of well-being. not just theory, but also practice, inshallah. So with that, I have a couple of terms that I'd like to share with you. The term psychology, because there's no direct equivalent of this in Arabic. And it's hard sometimes to understand what is this concept. It's often seen as something that is foreign or Western. But let's break it down together, inshallah. If you look at the word psychology, psyche means breath, spirit, or soul. Logia is the study. So the study of the breath, spirit, or soul. And this is how psychology originated, even in the European lands. And you see here that the concepts originally really were looking at the concept of the soul. Over time, however, we lose some of this because then it becomes a very scientific field in which if you can't reproduce something in a lab or scientifically prove it or touch it or see it under an MRI machine, then it doesn't exist. And this is a change for psychology. This is not how it originally started. In the Muslim equivalent of this, the term was called ilmun nafs, and someone said nafs earlier. And if you translate this as well, it's also the study of the soul, or some people would say the self, or the breath, tabam. And so when you think about what people were trying to do from the origins of the beginnings of humans, they've always been trying to figure out what is this human psyche and how does it work. And so this is not something so foreign to us that there is a difference between modern psychology and Islamic psychology. Whereas today, modern psychology is meant to be very secular. It shifts away from philosophizing and understanding what the soul is, the essence of that ruh and that nafs. And it's a very empirical and rational approach. So as I mentioned earlier, if you're in a lab, if you can look under an MRI machine, if you can test it, then it's science. Otherwise, they're not so interested in the soul anymore. In fact, there is a term in our field that says psychology has, quote, lost its soul, which literally it has. Really just the mind-body connection. Whereas if you look at Islamic psychology, we still take the empirical and the rational, but what's very important is we also take as one of the evidence that we use scriptural sources such as the Quran and the Sunnah. And you can't do this unless you're a believer and you understand that this is haqq, truth with a capital T. But we also study the physical and the metaphysical aspects of the human, which means that Islamic psychology is really coming from the frame of mind, body, and soul. And this is where the premise, literally, of Islamic psychology differs greatly from Western psychology, meaning that the very foundation or framework of the field starts from Islam, right? Because if you're going to put Islam before anything, it's got to start with Islam, and then you build up a psychology from it. As opposed to what we find as Islamicizing efforts, which is much more a top-down approach, where you start with a psychology, then you try to fit Islam into it. And so there's a debate amongst people in the field about whether you go bottom-up or top-down, but the point is, and you might understand my bias is very much a bottom-up approach, but the point is, you're going back to the Quran and the Sunnah, and that's very important in some of the distinctions that we're going to talk about today, inshallah. And so in the field today, this is the common model that is often used. It's called the biopsychosocial model. Biological, such as genetics, inheritable traits, for example, psychological aspects, and then social. Social meaning like environmental. So I'll give you an example, and Dr. Ahmad is going to go in much more detail, inshallah, about the specifics of the mental health conditions that we have. But think with me for a moment about somebody who maybe doesn't have any genetic or biological concerns. There's no history of depression or anxiety or trauma or anything in their background. But then they will go through war, and they experience life as a refugee. That person is going to be changed or shaped by the environmental social aspects. And they may fall into a depression, but not because it's genetic, but because of the environmental conditions that they just witnessed. Does that make sense? And so when we don't take into account biology, psychology, and social or environmental factors, we're also neglecting issues that could very well be the cause of things. And then there's something missing in the model today, and many people would say what's missing here is the spiritual. So the biopsychosocial spiritual model is what many of us as Muslims in the field, and other people of faith, not just Muslims, other people of faith as well, very much want to bring back into psychology. They want to bring the soul back in. I have many colleagues who are not Muslim, who are Christian and Jewish and Hindu and Buddhist and so on, who are very interested in actually bringing spirituality back into psychology. And even though our models of spirituality differ, I welcome the fact that they're interested in bringing this back in. And so there is a shift in the modern field today of psychology to rediscover or re-bring back in the concept of spirituality. So with that introduction, and we'll have a long time to discuss today, I wanted to give you a case. Yes? Nope, okay. Sure, yeah, thank you. I have a case for you, inshallah, and this is the case of Amina. And I'd like us to think about it for a moment together, inshallah. So here's the case. Amina comes to you, and she confides in you that she feels very hopeless, that she can't get out of bed in the morning. She doesn't feel like eating or gardening anymore. You ask her, how long has this been happening? She says, 3 months. And then you ask her, what do you think this is because of? And she says, it must be the ayn, or nazar, the evil eye. And then she says, I think somebody might be doing sihr or black magic on me. And she's unwilling to consider any other factors that could be affecting her mental health. So before we talk about Amina, how many of you know an Amina? I think we have more hands in the room, inshallah. And so I'd like you to take a moment together, if you could just take 5 minutes, if together, kind of just talk together amongst each other. How would you advise Amina, now considering the biopsychosocial spiritual model that we talked about earlier? And then we'll come back in 5 minutes and hear some of your thoughts, inshallah. It sounds like there's some good discussion happening, mashallah. But if we can take a couple moments and just hear from some of the groups what you came up with, inshallah ta'ala. We can start with the sisters. Would any of you like to share with our group? Okay. So mashallah, so you said a couple of things. You said you're going to start with acknowledgement, and then you're going to go through and ask some very specific questions about her, basically her history, her background. And something about the 3 months. You're curious about what happened in the 3-month mark. That prompted this. Okay, nice. What is it? So you want to ask her age, tamam, okay. So no. Her family history. Other thoughts? What is her proof, basically? Okay. Yes. Nice. Very nice. So what I'm hearing a theme that's kind of coming through, which is, validate, show empathy, listen to the person, maybe ask them why they're feeling this way or what is their interpretation of what's happening. But I also heard you say that you want to cover both of your bases. So you want to make sure, and your sisters had said this too, you want to ask things like, is she taking medications? What is her nutrition level? So on and so forth. And then you ask, maybe she had a baby, sure. And then you also ask things about spiritual. What is her spiritual practice like? And you mentioned ahl dhikri, right? Like maybe we need to make sure to bring in the people who might actually be able to help other aspects. Very good. So I think we'll come back to Amina's case in more detail. As we go a little bit further back, we're going to revisit the case, inshallah. And let's see how all what we are covering this morning, how it affects and shapes how we work with someone like Amina in our community, inshallah ta'ala. Dr. Ahmad?
Assalamu alaikum. Maybe I thought I'll share as well a little bit about my journey and my involvement in the mental health field. I was actually more interested when I was going through my studies in college I was interested in the brain and neuroscience. And in that process, I had learned that there's a field called neuropsychology where you look at the brain function and how it affects your cognition, your thinking skills, and your ability to make decisions and things like that. And in order to do that, and especially in the US, to become a neuropsychologist, you have to become a clinical psychologist first and then train further in neuropsychology. So I was sort of like majboor. I had to go into clinical psychology because I was really interested in the brain. But in that time as an undergrad, I read a book by Malik Badri. He has a famous, a number of books and writings that he's published. Allah yarhamhu, and he kind of is sort of the father of Islamic psychology in the modern time. And that was a very significant point in my life to understand that even if you enter the field of psychology as a Muslim, you have to have you need to have some filters and knowledge about what is you're getting into. And then another sort of significant point in my life was when I went to Umrah, and I met some of the mashayikh that I ended up learning from in Hadramaut in Yemen. And I was advised if you're going to go into modern clinical psychology, then at first, just as a talib al-ilm, just go and sit with the mashayikh and understand our tradition of what is the nafs and how do we discipline the nafs, and how our scholars have spoken over centuries about how a human can impact their mental health well-being through the spiritual practices in our own deen that's already involved in and from the sources as Dr. RANIA mentioned. And so for me it wasn't so much that I don't think so much about like the larger meta understanding of what is Islamic psychology. Exactly does it translate between ilm al-nafs and psychology? It's more just I'm a psychologist and I'm trying to be a good Muslim and I'm trying to benefit my patients. And over the years, it's been very eye-opening to see how our community in general, I feel over the 10, 20 years, it's developed, and even the ability that we can have this kind of session, and all of you are here is a testimony that our community, at least a good section of our community, is interested in this. If not, you wouldn't even have signed up for this program. You realize that there's a reality to it. It's affecting our community. When we think about in our Islamic spiritual practices, we don't have to always focus simply on illness, mental illness, but also the well-being side of it, which is a lot of preventive kind of things. So if you're spiritually balanced, then you're a little bit more resilient to face the tribulations and trials of the dunya, which we all know that this dunya has trials and tribulations. But if you have, our sort of our spiritual practice, a base of some balance, you're usually more resilient. And actually, there's a lot of studies in psychological research that if you have a religious tradition, you have particularly personal religiosity, that you have some connection with your spiritual practice, a higher being, that people who are going through various tribulations, could be medical conditions, something traumatic, something just recovering from a surgery. If you have a spiritual base, usually those patients have better outcomes in their recovery, in their rehabilitation. So, the field is, trying to, at least there are certain sectors of the mental health field where they're trying to go back to, as Dr. Rania, mentioned, how do we infuse, it's not just mind and body, but it is soul as well. And I think for me that really maps with Islam and Iman and Ihsan, that you need all three components to actually function in a holistic way. And so for all of you and your communities and what you're seeing, this this topic is so important because it's you as the leaders and imams and community leaders having the awareness and knowledge, but then also how will you present it to your community and spread that knowledge and find a place where it's very welcoming for the people who are most vulnerable in our community. So we'll talk later, today, and of course, if something we want to revisit, it's very flexible. But later, I'll kind of go through with you all just an overview of different mental health disorders, the common ones, and how the symptoms usually present. And it's kind of like a typical abnormal psychology class, but we'll condense it in a way that's more relevant for you and what you might see. And I'd like you just to think about it in the same way as you might look at any other diagnosis, medical conditions as well. That in the context, in the current mental health field, we look at like diagnostics, we look at symptoms, we figure out a certain threshold before we consider this an illness, or is it just some features, is it just some symptoms, or is it just normal human behavior? And it's normal. There's some stages, situations in your life where it's normal to have a reaction to a very stressful, experience that you're having. So it's something to consider when we're talking about how as a community we normally have heard this as if you have this lack in iman, or if you were more if you were just more religious, you would have been able to avoid all of these mental health problems. And as Dr. Rania had mentioned in examples also from our own Prophet ﷺ in his life, and many of the Anbiya, actually all of the Anbiya were the most tried of all the humans in history. And that, we understand this to be part of human nature, that you're going to go through psychological stress at some point in your life. Most people around their lifetime will have some point in their life where they will face something, could be significant depression, could be some form of anxiety. It all happens to almost all of us, and that's normative, actually. So, and in the same way, when we think about our community, will be very open to physical problems. If you have diabetes or you have some kind of chronic illness, nobody would ask you about, are you sure you're praying enough? Did you read enough Quran? Was it ayn or sihr? They don't say that for physical conditions. But if it's depression or anxiety or a typical kind of mental health, then suddenly we don't view it from the same perspective. So this is something that we as as a community kind of have to be consistent in one way or another. Like, you know, and so, you know, inshallah, during this day, you know, I'm hoping that we can cover some of these relevant topics. And again, if you have certain specific issues or questions, or I think we have time during the day where we can focus on some of these.
Thank you, Dr. Ahmed. So inshallah, we're going to continue here and talk a little bit more about this Islamic perspective related to illness in general and then mental illness in specific, inshallah. The hadith of the Prophet ﷺ that you see here is one that I use very often with my patients, and one that's been very helpful actually for me in conceptualizing how the early Muslims understood the teachings of the Prophet ﷺ and then inspired them really in an incredible tradition of healing. We all know the contributions of the Muslims to medicine, to science, to all the different humanities. Again, never heard growing up that there was a connection to mental health specifically, but obviously there is. And a lot of this work now is kind of unearthing so much of what was contributed, and in some cases forgotten, subhanAllah, but we'll get there. But this hadith of the Prophet ﷺ, that there is no disease that Allah has sent down except that He's also sent down its treatment, that you find in Sahih Bukhari, is a powerful hadith. And you have different narrations. This is, you know, different times of the Prophet's life, he was asked this question. So you have different narrations. And you have here, I'd like to invite you to think for a moment about how he answered this question, because he was approached one time by a Sahabi who asked him, when we fall ill, should we go get help? Should we get treatment? And if you read between the lines of what's being asked to the Prophet ﷺ, is essentially to say, is it enough, O Rasulullah, right, to just pray it away? And the answer of the Prophet ﷺ is not just about salah and dhikr and Quran, but his answer is very powerful, because he says, Tadawu ya ibadallah, right? Seek out treatments, O servants of God. Tadawu ya ibadallah, right? فَإِنَّ اللَّهَ لَمْ يَضَعْ دَاءً إِلَّا وَوَضَعَ لَهُ شِفَاءً. That Allah subhanahu wa ta'ala does not send down an illness except that He sends for it a cure, and in some narrations it says dawa, shifa and dawa, which is very interesting because modern medicine today, we have cures for some things and treatments for some things. And this idea of this is the push. So when I was telling you about the manuscripts that I was reading from old times, mashallah, the turaf, this hadith kept coming up. When they explain why they're writing what they're writing and what's inspiring them, this hadith kept showing up. That there was something clearly in our tradition from the sunnah of our Prophet ﷺ that if you're ill, you go get help. And there's no discrimination here between the physical illness and the mental illness. And I'll have some proof of that as we go forward, inshallah. But first, I'd like to introduce you to the concepts we mentioned earlier. I mentioned biological, psychological, social, or environmental. Also, we brought in spiritual, right? So we said the biopsychosocial, spiritual. And then there's something called the supernatural explanations, which, like in the case of Amina, you might remember, this is where we said ayn, or hasad, or sihr, or somebody might say maybe this is jinn possession, right? They have other explanations which are categorized, at least in literature, as being supernatural. And for us as Muslims, because of the fact that these are mentioned directly in the Quran, right? وَمِن شَرِّ حَاسِدٍ إِذَا حَسَدَ, right? I mean, it's directly in the Quran. And the discussion related to both jinn and sihr is part of our tradition. It's not something we could just push away and ignore or neglect. The realities is Allah mentions them, and He also tells us through the Prophet ﷺ how to protect ourselves from such things. But it does not limit the Prophet ﷺ in giving this as the only explanatory models for what's happening. So let us look at this together, inshallah. When you look at the Islamic perspective of why somebody falls ill, whether it's physical illness or mental illness, you find different themes that emerge. For example, that it's a test or trial from Allah subhanahu wa ta'ala, right? وَلَنَبْلُوَنَّكُمْ بِشَيْءٍ مِّنَ الْخَوْفِ وَالْجُوعِ وَنَقْصٍ مِّنَ الْأَمْوَالِ وَالْأَنفُسِ وَالثَّمَرَاتِ, right? The concept of trial and tribulation is part and parcel of this tradition. Or the expiation of sins, like the hadith of the Prophet ﷺ that talks about even the prick of a thorn will expiate your sins. So imagine something much bigger. Some talk about it from the rahmah of Allah subhanahu wa ta'ala. Or it could be a punishment or reminder, or an opportunity to ask for forgiveness, or a spiritual purification, a growing edge, right? That Allah is, the concept of Allah subhanahu wa ta'ala wants to refine you, He's going to test you with something. Right? مَنْ يُرِدِ اللَّهُ بِهِ خَيْرًا يُصِبْ مِنْهُ. Right? He's going to actually cause him some sort of tribulation that will refine him and better him. So when you think about the spiritual causes of illness, now try to superimpose that onto what you see here. Which this, if I go straight to mental illnesses and the stats and kind of understanding from your typical psychiatric textbook, it's going to talk about the kinds of mental illnesses, which Dr. Amar soon is going to go through each one of these with you and kind of give you explanations of what they are and how they show up. But it's interesting. You're not going to find this kind of breakdown that we talked about earlier in the DSM, or the psychiatric diagnostic manuals of diagnosis, right? You're not going to find those things there. But in our tradition, we care about these things, as well as we care about these titles too: anxiety, depression, PTSD, adjustment disorders, and so on. And this is where the dilemma, again, of Islam and mental health comes in. And the revival of the field of Dr. Amar mentioned, our mentor, Dr. Malik Badri, rahimahullah, and others who really have revived in the modern era the concept of Islamic psychology and kind of brought it back to the surface, which is, in addition to everything we can diagnose medically, psychiatrically, we also have to be able to diagnose the diseases of the heart and work with the inner spiritual state just as we work with the outer. And I think those two together are very important. So if you look at the statistics here, if we look at them together, let's look at the United States first. You see that the largest percentage goes to something called anxiety disorders. This is just kind of the sense of something is off. At very basic level, a person feels anxious or worried about things, and it could be different buckets of things: family life, job, home, right? How their kids are doing, etc. Maybe it's also spiritual concerns, all these different anxieties. About less than that is depression, although prevalent. And then there's going to be a certain amount of people who experience trauma in their life. Something has happened that's traumatic to them, right? And it could be as simple as a car accident, or it is as extreme as war or natural disaster, right? It could happen. And dual diagnosis is related to addiction or substance abuse. So when you look at the Muslim population, this is really interesting. The data is a little bit older now, but generally speaking, you actually find that the largest percentage in the Muslim community was something called adjustment disorder. And since Dr. Ahmad is going to go into much more detail, I'll just say very brief what this is related to, but it's very much as the word sounds, that a person isn't fully adjusting to whatever is happening around them. And if you think about it, you have Muslims who have been born and raised here, who have been here in certain communities, such as our Black and African American communities, have been here for generations. And you have other Muslims in our community who have just recently come, and many from very war-torn, difficult parts of the world, in which there's so much happening there. And some of that's coming with them, and there's a level of trying to figure out different generations, right? One generation to another is maybe not seeing eye to eye. So adjustment comes up quite often. But you see that everything else just about kind of maps onto what the general US population is experiencing. And this is important too, because the rhetoric sometimes that we hear in our Muslim communities is, if you were to just, like you said, if you were to just pray or read more Quran, we wouldn't have what they have, whoever they being. And here, it's just not accurate, because you're not taking into account genetics, biology, environment, which some of those causes, particularly the environmental causes, might be actually much higher than what the typical American person may experience if they've never been from a war-torn country, or what we call having a heart in two lands, in two places. And so this, is very important to understand that some of this is going to be part and parcel of our community regardless of how spiritually connected they are. But certainly deen and spirituality will absolutely help, but not necessarily completely eliminate. I'd like to take a pause for a moment because our next discussion is supposed to be on stigma, but I'd like to just pause for a moment and see if you have some questions for Dr. Omar or I. Not at this stage, if I could just ask, not at this stage, specific case scenarios and very, very detailed questions that you might have from your communities, because we will have time for that later, but more related to our introductory hour. Any questions for us?
Sure. So the question is adjustment disorders. Normally in our clinical practice, when we're trying to look initially, what are the symptoms? How is this struggle you're going through impacting your life? And it could be affecting your sleep, your appetite, your emotions, your thinking, your cognition. So many things could be affected. So some of it is just when we look at the diagnostics, the adjustment disorder is usually considered a sort of lower level than like a full-blown depression or a full-blown anxiety disorder. The adjustment disorder could be adjustment disorder with depressive symptoms. It could be it could be adjustment disorder with anxiousness. It means that the person is not necessarily at that high levels of significant psychiatric illness. It's just that they're in a struggle. Likely it could have been related to something difficult in life. Simply could be moving from one country to another, or even one house to another house. You can have adjustment challenges. So anytime you're in a new context or you're faced with a new, stress in your life, typically the adjustment disorder is the first thing that we think about before we go to full-blown, depression or anxiety. And also could relate to the timeline. If you've been experiencing some symptoms for a number of weeks, that's different. But if you've been struggling for months and months, then you might be, beyond an adjustment, into something else. So there's ways that we look at it, but in general, if I were to give you a very simple way, it's just a more less intense presentation compared to the full-blown diagnosis. Yeah, and we could talk, when we get more into like the, the way that clinicians may look at these conditions, but typically some of it will be very similar to the more severe cases, but it also may not be as intense in terms of a treatment. Might be a little bit more conservative initially, just looking at lifestyle. Especially if you're a holistic clinician, you want to understand what else is going on in your life. You may not necessarily need like an intervention right away. You might just need some psychoeducation and realize some of these things are normal. Some of these things are stressors that you need to address. And some things, if you just had some strategies and some knowledge, you might be fine. You don't need necessarily a therapist to help you with this. But it'll kind of depend on the how much your functioning is being affected. Yeah, so he mentions the idea of normalization, which is great. Because the other problem is that there is a problem of over pathologizing people, like making them feel that they have a problem when actually they're just going through normal human reactions. And unfortunately, there's a lot of unethical kind of clinician practices where people over-diagnose people.
just quickly add to that that it's that as a psychiatrist, I don't give any medications for somebody in adjustment disorder. It would be very much, as Dr. Ahmed mentioned, lifestyle therapy potentially, and supportive therapy is often what we call it, or even just other forms of therapy that could be useful. And it could also be something that, and I'll tell you, in our diagnosis, when we diagnose, because we don't want to jump to anything and kind of put a label on somebody, we might kind of keep them as adjustment for a while. For a lot of my patients, I sort of keep them there until I can see, is this really becoming a full-blown depression where we have to go in much more deeper kind of clinical treatment, or are they going to be able to turn that corner after some work with them and help? About an Islamic DSM? There are. The question is, has there been any thought given to creating an Islamic DSM? There is a group out of Indonesia right now, I believe they're in Indonesia, mashallah, who have looked at the works of Imam al-Ghazali, because there's so much on Matlarat al-Qulub, right, kind of like purification of the heart that he does specifically in his Ihya, and are trying to create something similar. And it's probably going to pass sooner in a Muslim majority country than it will here, but I think it's a very interesting concept. I do. In fact, I have a meeting with them next week. I think there's a discussion on potential collaboration with our lab on that project. Inshallah, we'll see where it goes. Yeah. Spend on the back. Yeah.
Yeah, and I think Dr. Rania she'll have a certain part where we're just going to focus on the question was about midlife crisis and even some of the struggles that the Imams are having. And so it was just mentioned that we will, inshallah, focus on some of these topics today, and there's even a section where we will discuss about, Dr. Rania will present on self-care practices for the Imams.
Allah bless you. It's actually a fascinating question related to how does the DSM conceptualize, how does modern psychiatry conceptualize something like an anger disorder, which is something that they do discuss. And then your question about, can it become something that's no longer out of the norm because it is his norm, which is very interesting concept as well. And here, this is where definitely, and subhanAllah, I'll just say this, and I don't know if Brother Sadiq was here, but subhanAllah, our group had been writing a paper that we did not have a chance to finish, and we hope will be part of the next year's AMJA conference, inshallah. But it was actually specifically on, similar to what you're asking, which is taking each of the psychiatric conditions and asking what is the had, basically what is that limit after which they're no longer rational. And so it's a work in progress. We're still working on this, mashallah. It was too ambitious to try to finish it all by this year, but I hope by next year we'll be done with it, because this comes up very often. Because you're mentioning anger, but somebody else is going to mention, well, what about if they're bipolar and it's a manic phase, which kind of goes in and out, in and out. What do you figure out then, for example? And so on and so forth. And so just in brief, could it be that it becomes part of that person's personality? We would still say that that is psychopathology. That's not going to become normative, because it's not normal human behavior to have that threshold of anger for that long. Does that make sense?
If it happens once a year, it's a lot easier to say. If it happens once a year, it's a lot easier to say, it's not out there, go ahead and keep your marriage. But if it happens 6, 7 times, and each time, the defense is he's unnaturally angry or abnormally angry, then it becomes a little.
Yeah, you're right, and it does. And this is. And I would argue and say this is actually part of the khilaf on these rulings specifically, because there are those who say, look at the Shafi'i madhab that says anything and everything is going to be considered divorce. You said it, it's on you, right? Versus the other ends of the spectrum that are going to be potentially more lenient. or and then other kind of more modern fatwa on this very topic. But you're right. I mean, there is a question of like, what is that threshold, and when do you finally get to it? Because I could say, even to me, potentially more interesting than anger is somebody with obsession and compulsion, right? So somebody who is obsessive, who says the word talaq out of a compulsive nature. They just cannot seem to stop themselves from doing that. And yet, subhanAllah, when you look at that illness, it is irrational. They know, and they're bothered by the fact that they just can't stop themselves. You're compelled to act in this way. Yet we would still diagnose that as a potentially an illness, right? No, hold on. Yeah.
Quick comment about the anger. It was not mentioned the hadith, the anger actually. And by the way, the hadith is weak. All agree that it's a weak narration. And all they apply that on that narration. And the hadith, la talaqa fi ighlaq. It's not like in anger. And in ighlaq, like a blackout. You can have no control, cannot see. So this is not necessarily that the state that a person has in his personality. At that moment, the situation, the circumstances that happened to this. So me and as an imam, for example, when they come to me, he said, I was angry. It's okay, who is divorced when he's happy? You know, they're angry. But I told him, do you remember what happened? You know, we were told you said that word. Are you aware of the situation? He said, yes. Then you are having the control. That's the point, the word iqlaq, I mean you have no control. There's ikrah, there's somehow a force inside you or outside you, you know, that enforces you to say the word, you know, and that's out of your control. So you are not at the plane, and that's not going to be, there's a consequence of that. So it's not a literary anger. I don't know why the focus on anger was not mentioned in the hadith. In the first place, the hadith is not authentic. Second, it's not the interpretation of it.
Yeah.
Allahu a'lam.
And I think this is, and just to close this, we'll take a couple more questions just to close this part of the story that is, and this is why I don't want to focus just on the anger. I think we need to look at it more on like, well, what happens in mania, which is chronic, for bipolar, what happens in OCD, which is actually a chronic condition. And this could happen again and again. I know it's very heavy when it keeps happening, but what do you do with somebody who's chronically ill? And I think that's, inshallah, what we hope to figure out with some of the papers and probably with discussion of these with all of you here, mashallah.
Yeah, and this is not a question, but just to add on to that, it would apply in so many different ways as well. Where, like, if a person, like you mentioned, obsessively would do things, then, you know, like redoing their wudu, it would apply to them. In if a person was, you know, again, the same thing with perhaps another OCD type of element, or a mental health effect that is causing them to lie. Does this person become known as a liar, even though we can perhaps pinpoint that this is the reason why he's doing it? So it'd be very interesting to see that research, inshallah. Inshallah, sir.
So besides being an imam, I'm actually an alcohol and drug counselor, so I know exactly the 12 steps program, and I'm doing it actually with my people who I'm serving in the prison. But there was an attempt, you know, to do it by the Islamic fashion. It's called Milati Islam, and they started in 1989. They're still existing until now. So I just want to emphasize that, you know, there is a Muslim approach of fighting drugs and alcohol and addiction. And it's not something easy, honestly. Like, I'm doing both things, imam plus being an alcohol and drug counselor. It's not something easy. And we should really try to find all the steps, you know, related to Islam, Quran and Sunnah, so we can apply it, you know, to our, you know, congregants and patrons, for sure. Jazakumullah khair.
If I could share with you a resource for you and also for everybody here, inshallah. The Taiba Foundation, which is an organization working with the incarcerated, Islamic education to the incarcerated specifically. We actually just reviewed at the lab a new book that because they put out various books that are going into the prison across the US. And one of them now is called Overcoming Addictions, something like the Islamic Principles of the 10 Steps. And these are two brothers who are both have life sentences. They're both Muslim brothers in prison, who, subhanAllah, Allah bless them. They actually rewrote the 10 steps from the Islamic perspective because they're also trained in the Sharia, mashallah. They've gone through the entire training with the type of foundation instructors of the deen. And so they were able to kind of do this, and they actually practice that in the prison system, mashallah, with the Muslims that are in prison dealing with addiction. And the book is now available on Amazon, so you're able to just purchase this and use it if you'd like to use it. The Millat Islami is definitely much older. This is a renewed version of the 12 steps from the Islamic frame, but written from people who are lived experience with it, and themselves, subhanAllah, they're still behind bars. May Allah free them one day. Ameen. Overcoming addiction. I will pull it up for you shortly, inshallah, and put it on the screen. Of course.
Assalamu alaikum. Before I ask my question, subhanAllah, I just learned about the 10 steps about 2 weeks ago from a person who was converting to Islam, who's gone through these 10 steps, and when he was learning about spirituality, he chose Islam. He learned about Islam, he chose Islam, subhanAllah. My question is about I heard you speaking about the spiritual impact in healing, and it was repeated: read Quran and make prayer. Read Quran and dua. That these are the advices that are given to the people. The way I look at ibadah is that it's like a system. Okay. The way I look at ibadah is that it's like a system. Subhanallah. For example, we always speak about social support for a person who is struggling, right? Subhanallah, even financial support or anything for people who are adjusting, and many other things. If we practice Islam as a system, for example, the person who goes to the masjid and pray 5 times a day in jama'ah will feel that social support. The person who stays away from the masjid will feel loneliness, and that will increase their anxiety. And so, does the ibadat, or does the ibadat of Islam, or the practice of Islam in general, work as actually a protection, not as a way to heal only, but a protection from these psychological challenges?
Sunnah. Yes, you're right. I mean, I think we don't want to obviously discount the Quran and the praying and the ibadah in general. We do kind of, it's used in these quotes when we're sort of characterizing sort of the problem in the community, when that becomes the blame about a mental health person's struggle, that they're weak in their or maybe they're lacking in their ibadah. But of course, as Muslims, we obviously believe there's a intrinsic benefit to the ibadah, for our own life. It's not that Allah needs these acts of obedience. It's for us. And so I think if we, I thank you for kind of, highlighting it from that perspective, because I don't want to I don't think we should minimize that and kind of make it as it doesn't have an impact. Indeed, it does have an impact. And in fact, in the holistic sense, your ibadah is meant to support your well-being. Your day-to-day functioning should be stronger. You should have more resilience. But there are times when you're faced with things that are just totally out of the norm. Certain stressors in your life, certain challenges that are not expected, and then at that moment you may have just an overwhelming feeling that, and your ibadah was fine, but it's just you might need some other support in those times, socially supported, community support, psychological strategies, and if it's very severe in your symptoms, you might even need medication for temporary time, So all of these things are there. And I appreciate you kind of mentioning it from that perspective that of course, our spiritual practice in general, I feel, has a very protective role in our functioning.
I'm just going to finish answering this, if that's okay. I'm just going to add one thing. Mashallah, there was, in my research lab, there was a study that we did recently in correlation during the COVID-19 pandemic, and it was done with the Yaqeen Institute. And it was a really excellent study, mashallah, because it was looking at how did Muslims understand something like the pandemic, and also what was their own practice level. And it was very clear, the connection between their own understanding of, or their own practice, if you will, of Islam, and their conceptualization of why Allah subhanahu wa ta'ala sent the pandemic. Is it a test, a tribulation? Was Allah punishing us? Was he punishing China? I mean, there was all kinds of interesting ideas that people had. And then if you looked at certain concepts, particularly the one that stood out in that study was something called uncertainty intolerance. And so basically the inability to tolerate uncertainty, which the pandemic brought so much uncertainty to us. And this is a function of anxiety. But if you look at it, this idea of tawakkul, right? Like we're doing our part, but then we have to have tawakkul on Allah subhanahu wa ta'ala. We don't know what's happening with this pandemic, especially at the height of it. And we're going to put our tawakkul, we map that with how people were doing mental health-wise. And it was impressive, mashallah, because it meant that a person that had high levels of uncertainty tolerance, they had less of a chance of developing mental health conditions. And the ones that had higher levels of uncertainty intolerance, they couldn't tolerate the uncertainty, their levels of major depressive disorder, or MDD, rose by 60%. So it was a very clear correlation. Even my colleagues at Stanford, who are very scientific driven, they were so impressed by this. They kept asking, how do you reduce something like MDD, major depressive disorder, by 60%? I mean, it's a very powerful study. And this is what we were trying to explain, is the power of religion, the power of faith. It is very powerful, subhanAllah. But as Dr. Ahmed mentioned, you can't just limit it, because you see here in the examples we gave earlier of the Prophet himself, sallallahu alaihi wasallam, and other prophets, where you have moments of intense grief or difficulty that happen as well. That is normative. So I hope that helps, inshallah. Yes, sisters, mashallah, any questions from you? Yes, dual diagnosis means that it's both one of the mental health disorders, like depression, anxiety, plus a substance abuse disorder. Oh, no, the Muslims definitely. So the question is, do Muslims also have dual diagnosis? Absolutely. Absolutely. There's addiction, absolutely, in our Muslim communities. As much as we don't want to identify that sometimes, it's, as many of you all know, it's quite prevalent at times in our communities as well. Yeah.
Repeat. They didn't hear a thing.
My question was about the dual diagnosis in the non-Muslim population. I just was inquiring what the dual diagnosis meant, which means that if they're addicted or they're using drugs, they also have the other diagnosis, like anxiety, depression. And certainly we have it in our own Muslim populations. I didn't see it on there, so I was inquiring.
Yep, you were clarifying. Thank you.
Assalamu alaikum warahmatullah. First, a quick comment. I mean, we haven't even gone through the entire day, but I strongly suggest that Amjad makes it part of the regular program and not just an optional workshop, because the way I think you've constructed this course is absolutely pertinent to what we need, as spiritual advisors. The second thing is, the brother had this comment about spiritual practices. Since I've been studying a little bit more about psychology and coming across this term mindfulness, if you can just elaborate on that, as maybe you already have that, And how our spiritual practices actually, without us even realizing, make us trained to be so self-aware. But I think if we just knew it at an intellectual level as well, we would get more benefit from it, inshallah. Jazakallah.
I think we're going to both touch on this concept over the course of the day, which is the concept of mindfulness. I have a little bit of an issue with the term just because it's not, for me, the research has to be something that's indigenous from Islam up for me to feel comfortable. So what we have is something a little different in the Islamic perspective, which is kind of a contemplative meditation, kind of a tafakkur and tadabbur kind of concept, as opposed to this more Buddhist origined, secular now mindfulness. Not to say that there isn't a benefit from it, but I think what we have in our deen is actually much more potent. And I guess I'll say now that of the many things that we're writing, one of the books that we actually just signed a contract to write is the concept of what is Islamic contemplative meditation compared to mindfulness. And so people are not very happy with us because we're pushing against a field that is trying to put a very secular concept onto us. I'm not denying that there is benefit. There is research that shows that it's beneficial. I just think we as Muslims have something much stronger, inshallah. Yes, of course, the tadabbur and tafakkur and so on, yes. I think we have time for just maybe one more question and we'll get going with it now. This was the time. Thank you for your comment, but this was the time. Thank you. Bismillah ar-Rahman ar-Rahim wa sallallahu ala al-hadi Muhammad wa ala alihi wa sahbihi wa sallam ajma'in. So we'll continue on with the discussion, inshallah, of stigma and some strategies to be able to reduce it. So similar to our other previous discussion earlier, I have some more questions for you. And the question here is, mental illness can only be cured spiritually. So my question here for you is, how many of you have heard this statement before? We have one brave hand. Okay, a couple brave hands. Thank you, mashallah. Now, the reason I bring this up in the discussion of stigma is because this kind of attitude, as we discussed already, can really reinforce stigma around mental illness. And then it creates these barriers from getting the help one needed. And it's not part of our tradition, as we mentioned as well. The Muslim tradition is very much one in which we are specifically told to seek out help when needed. And so, as much as we want to tell people that there are aspects of our deen that actually can help, like this whole discussion we had here earlier about the connection between spirituality and doing better mental health-wise is clear. But when you reduce it to only, that's why that word is bolded, only, then you start to really reinforce a stigma. And the stigma shows up in many different ways. So I'd like to show you the different ways that stigma shows up potentially. You have community level, relationship level, and individual level. So let's look at this one by one. So let's look at the community level. The community level is when you say that this is such a taboo issue, or it's problematic, or it doesn't belong in our community, or it shouldn't be part of our community. And then I have a couple of quotes that are actually real quotes that I've either heard people say or have experienced very directly, such as in my own masjid, where, for example, the first one, what would people think if we had an Alcoholics Anonymous, or AA, in our masjid? Does anyone have an AA in their masjid by any chance? Oh, we have 3 hands. But tabarakallah. We're going to have to talk to you after this, inshallah. What is it? You have Alcoholics Anonymous. Tamam. Alhamdulillah. The concept of AA is interesting. I mean, it's not our topic today, but I'll just say very briefly that the concept of AA and the 12 steps that we were mentioning earlier, they have very clearly a religious connection, and they mention God very clearly in this discussion. But anyhow, when we tried to propose this at our masjid, we had a lot of very interesting pushback, even though it was clear that there was substance abuse issues, alcohol issues, and so on. But the answer the pushback from the board came, we don't want those kind of people in our masjid. And those kind of people are in your masjid, is the issue, first of all. Second of all, whatever those kind of people means. And second of all, I think they were also concerned what would happen when outside people, not from the masjid, come into the masjid, and what kind of space would that create. So hopefully in the next segment where we have some discussion time, we'll come back to this comment. But you can see what happens when there's a refusal to acknowledge that there is actually an issue that's happening in the community. And there may be solutions to it, but we're also not even looking at the solutions because of this heightened stigma or of saying this is a non-issue for Muslims. Islam says alcohol is haram, therefore we don't have this issue. Which of course Islam is perfect, Muslims are not. And so this concept of making sure that we address them, but you can see where the taboo nature comes in. Or today's Muslim youth think that they have depression and need therapy, and that's only because they're not praying enough. And so you hear often, especially with talking about young people, it's like, what's wrong with these young people? They have everything. Why are they so upset? Why are they so depressed? And again, neglecting that there actually might be some real conditions. I mean, we all have emerged out of a global pandemic in which the youth in particular, their mental health concerns nearly doubled compared to adults. So when you think about what that means, you're also denying something potentially that could be, and it's not you, just the community may be denying the kind of resources and help that is needed. And then on a relationship level, there's shaming language or putting people down. So for example, be careful around Ahmed. I heard he sees a shrink, so he must be crazy. Right? This is very common. One time I was sitting with, in therapy, I was working with a woman, and she had a really, really hard case. And I said to her finally, what took you so long to come and get help after all these things happened to you? And she said, well, one time long ago, I was sitting in a social gathering, just family, friends, other woman, and she heard not about her, nothing to do with her. She just sat down, and there were two other women talking. And one woman says to the other woman, did you hear about, I don't know, Fulana? She started to go see a psychologist. And the other one said, oh, something must be really wrong with her, like that kind of reaction. And so in her mind, my patient, right, long ago, in her mind, she said, oh, I'm never going to go see somebody. If that's how people talk about somebody who goes see a therapist, I'm not going to. So the way we talk about it has a ripple effect in our communities. And when people are much more, talking about the word normalizing, when they're much more willing to normalize that, yes, maybe I need for a portion of time some help in therapy. Or maybe, I'll tell you, in the work that we do, in the 2 clinics that I've now worked on, Muslim mental health clinics, Madistan being the newest one, the single most asked for therapy is marriage and family therapy. And this is not because anyone has a diagnosed mental health condition necessarily. It's not because we're dealing with a depression or a psychosis. It's marriage therapy between 2 people, or parent-child therapy, or something related to the in-laws, or something related to generations of people living in one house, or so on and so forth. And so when we prevent that from happening, or we kind of put all the stigma and shaming language, then we also prevent people from healing and getting better. Or this other statement, Ahmed is feeling like this because he's not religious enough. We've already discussed this one before, but this is a common concept that happens often, right? It's said often enough. If he were to just do this or that, he would be not dealing with a depression. Then you have the individual level, which is ignoring the warning signs and avoiding seeking help for fear of being stereotyped or discriminated against. So this is where you yourself actually have a stigma to yourself. You may say something like, I need to keep these thoughts to myself, I can't be weak and live on medications or therapy. Or you might say, I can't share how I'm feeling, because if I do, I'm worried my friends will think that I'm crazy. And so there's internal thoughts about not actually getting the help when needed. And so different people are going to deal with stigma from different perspectives. The problem is you're going to find, The problem is you're going to find that this actually is, unfortunately, dangerous. It literally is dangerous, because when a person reaches this point and prevents themselves or their community or their family, prevents them from getting the kind of help they need, then we start seeing the really terrible things start happening, where people start coping in other ways, because you're going to cope one way or another, either healthy coping or unhealthy coping. So people, this is when they start to turn potentially to drugs and alcohol, or they turn to other forms of addiction, or potentially they turn to self-harm behaviors. And in the last case scenario down the line, which we are very concerned about, self-harm eventually turns into actual suicide attempt and potential death by suicide. And these are all issues within our community. This is not something that we can deny, I think, any longer. I think if I were to ask and survey all the imams here, how many of you have buried in this last year alone, somebody who's died by suicide? I'm sure you have. I'm sure you have. We just had somebody, a prominent member of our community, family in our community, just this past week. He was just buried yesterday. And so it's really hard. And you ask, what happens when somebody does not, or the whole community, or the family, or whoever it is that's or themselves, putting pressure on, I can do this by myself, and then they can't, actually. This is really what ends up happening. That's a lot of color. So I'm sure we'll talk about this a little bit more as well. Clarifying question? Tamam. When the physicians are pushing, what do you do when the physicians are pushing the stigma?
But nobody heard the questions and he's hearing your answer.
Sorry, the question is, what do you do when some physicians are actually contributing to the stigma? And it's kind of
No, I hear you.
confusing because they should have the background.
They absolutely should have the background, but they are humans too. And in fact, I had a patient one time who is married to a physician, and once you mentioned giving birth, once she gave birth, she had a postpartum depression. And that postpartum depression, if you know anything, we'll go through this, Dr. Ahmed will go through different conditions soon, but you'll find in postpartum depression especially that one, is very biologically connected because it's related to the hormones of the woman. So the same hormones that were able to keep the baby in her womb are the same hormones that might drop very quickly and cause the postpartum depression. So often, it could be other aspects, but this one in particular is very biologically oriented, which means that we have medications to help with something like this, and we have to keep a very close eye on her, because if you allow the postpartum depression to keep going, it can turn into a psychosis. And then you hear these terrible stories where the mom takes her life and the life of the child, right? It's terrible, terrible stories. Anyway, this person that I'm telling you about, the patient, her own husband was a physician, and he kept telling her, there's no such thing, no such thing. And you're like, how did you go to medical school? You know, subhanAllah. But he just couldn't believe that his wife could, go through something like this. So people, unfortunately, have their own stigmas, and it's going to take a whole effort to really combat that, even sometimes the most learned of us in the field. Yep. Clarifying as well, because we'll have time for questions, inshallah.
When you mentioned the community level stigma, I didn't completely catch it. Did you say that people today are twice as likely to have
Oh, I was saying the clarifying question about twice as likely, it was related to the youth. So I was
youth
saying that
today?
after the pandemic, all the stats on youth mental health have doubled. Depression, anxiety, trauma, all these things have
in
doubled.
comparison to before the
Previous to the pandemic.
before? Oh, wow.
Yep, of course. So at this stage, I would like to take a couple more minutes of interaction so that you're able to talk with each other a little bit. And here's my question for you. How can we motivate the individual? Think about Amina. Remember the case of Amina? We said we'd come back to her. Think about Amina, who does not believe in therapy, right? She thinks that it's solely a spiritual problem. And you, as the imam, realize there might be something, or as the spiritual advisor or leader, might realize that there's something more that probably Amina needs. How are you going to move the needle? How are you going to help convince her? So if we can just do that for a few minutes, inshallah, and we'll come back. All right, barakallahu fikum. It's always hard to interrupt a very good conversation happening. And the training specifically has these segments of having everybody discuss together, inshallah, and then coming back together as a group. The hope is that, inshallah, there's some direct putting theory and thinking of what's on the slides into some practice. So we would love to hear some of your thoughts of how you're going to discuss with Amina or someone like Amina, inshallah. Yes, bismillah.
Until we get the mic and speak clearly. And if they didn't express the question correctly, repeat it for us, please. Thank you.
Thank you. I'll begin that I will listen attentively to Amina first, give her all attention. Second, I will acknowledge that the courage that she came and talked about her issue. So I will dismiss the fear that she would have, and I said that's a good thing you did, and reaching out. And at the same time, I would tell her, your problem is not something unique. Actually, as you think this is because of your lack of spirituality, I can guarantee you that people on the first line of mosque never miss salah, and actually even some imams they went through as you're throwing even worse. So it's not something that because of a lack of spirituality. In fact, will be more close to Allah subhanahu wa ta'ala, be more tested, regardless that a jinn issue, as maybe would think, that position or ayn, or they think it's a mental, regardless. Even shaitan, he's not going to care about those going to nightclub, but he care about those that come into the masjid. لَأَقْعُدَنَّ لَهُمْ صِرَاطَكَ الْمُسْتَقِيمَ. I would say to them in the straight path. So I would try to, first of all, say, what going through is not because of, you are not doing enough and you're not like really good in spirituality. Actually, will be more high in spirituality. You are facing more trouble, actually. However, you'll be more close to Allah. That will help you to tackle your issue. No doubt with this. Yes, so yes, you should try your best more, more dua, more other things, but has nothing to do with your problem. And that's the main point I have to clear out. And then I said, depends on her issue, I will try to refer to her to somebody, and I will do even further step, if made that connection to the community, because sometimes they will, listen to you and not taking action. So I do have in my masjid, volunteer committee that dealing with those from a professional people, psychiatric and others, that are willing to accept any person, that being referred by the imam. So I could, make that connection and go from there.
Thank you. That's great. So I like how you outline the different steps. There's an acknowledgement, there's an understanding of where she's coming from, also kind of a questioning, kind of like having a dialogue. That's very, very important point. Often we hear people say, I tried to have a dialogue, but I was immediately shut down, or I was given kind of an immediate answer, kind of like stamp, done. Whereas a lot of times people they've been in their mind for so long grappling with this, and you said something very important about being brave to come forward and congratulating that person literally, because sometimes it's been years that they have been grappling with this over and over, and when they finally find the words to finally admit that they're having a hard time, sometimes they're immediately shut down, and then they don't never want to try again. So this is very, very useful. Thank you. Yes.
And also we were together. We also discussed validating the notion that your mental problems may not specifically be because of a lack of spirituality, by tying in what you had mentioned earlier about the Prophet sallallahu alaihi wasallam feeling some specific emotional distress, as well as encouraging the congregant member to seek help, just like the Sahaba used to seek help with the Prophet sallallahu alaihi wasallam. And the last thing would be, in an effort to help them or motivate them to go and actually seek therapy, would be to challenge the notion of why they have come to the conclusion, or specifically for Amina, how she came to the conclusion that that this is sihr and it's not something else, and can this be related to a lack of accountability?
Yes, very nice. Kind of like externalizing it, putting it on others or other things, but what about turning inward and saying, could there be something that maybe that person is doing? And then figuring out when they're ready to hear that, right? Because it might take a little bit of work to get there.
Of course.
Of course. Very nice. Yes. Shall we go on this side of the room first, and we'll come back, inshallah, and then sisters, you have one? Yes, excellent, okay. Tafadhal. Yes. Oh, you're waiting for the microphone. Tamam, thank you.
Where am I going? Taken from this side first.
Assalamu alaikum.
Wa alaikum salam.
one of the things, I guess, was more structural, and it could be encouraging more طلاب العلم to enter the field of psychology. So there's like a pathway to referral, and it's not an abstract thing of like go seek therapy, but you don't know what the steps are to which they could even get a first session, or who is that you're sending them to. And perhaps even having your own personal experiences with therapy. So then it's less of an abstract thing, and then more so you can say it's something I went through, and perhaps that could make it like, even if the sheikh has done it, perhaps it's not so bad after all.
Thank you for that. Excellent comments of several things. The last thing you said is very, very powerful, which is the concept of personal experience or personal vulnerability. And this is something you have to decide if and when you're ready to share. You don't have to. But I've had many conversations of my circle. As I mentioned earlier, not only am I part of an ustada, kind of like woman who've studied circles, but also my husband's a sheikh, right? And so seeing kind of his world and everything that he holds and kind of carries, and fully understanding that there is a lot that all of you carry. That's just the reality of it. You carry a lot, that's tabarakallah. And the advice over time, and I know this from many of them just connected to our network, many of those individuals actually are in therapy, but they're not necessarily ready to say that publicly. And sometimes I will say to them, when you are ready, you don't have to get up on the minbar and say, I am in therapy. But it could be in the middle of a conversation, or in the middle of a khutbah you're giving, in the middle of something you might say, and in therapy, because such and such happened, or the therapist said such, and so people kind of connect the dots and realize this is a person who also is a human that needs support and help and assistance. And then it kind of almost like gives permission to the person, because if the imam is going, then it probably is okay to go, right? If somebody's hesitant about going. One time I was talking to a group of imams who had just had a crisis happen in their community. It was a very difficult time, subhanAllah. And one of them said to me, he was a youth director, and he said, I tell the parents of the youth that I work with all the time, because I know that they need therapy, and the parents are usually one of the barriers. And he said, I say to the parents, I have friends who are Muslim therapists, and they're really good people. You should trust them. It's okay, so and so. And so I said to him, thank you for saying that. But how much more powerful would it be if you said to the parents, and I go to therapy? And he just sort of looked at me. I think I caught him off guard. But just to think about, kind of what that means when you put yourself in those shoes. If you're going to give that advice to somebody, what does it mean to practice it yourself? And the possibility, as I mentioned, mental health, and we're going to have this hour with Dr. Umar where we go through all the different diagnosable mental health conditions. But what about the other things that was in the umbrella of mental health, such as marriage therapy, family therapy, parenting, aspects that may not be diagnosable, but absolutely potentially need some help and support. Does that make sense? Where's our mic for the sisters? We'll take another example here, and then we'll kind of move forward, inshallah. I don't know where the mic is. Oh, mashallah. Okay. Tamam.
Well, the brothers pretty much mentioned a lot of good ideas, how we would motivate her, and some of the things we came up with, like, yes, must be very stressful for you. How would you like to seek some therapy or talk to someone who is trustworthy, someone that you would be comfortable with, and explain to them, because there's a huge stigma with privacy. They think the minute that you propose this to them, you're going to go tell other sisters, you're going to go tell everybody. So privacy and trust in the community. So that's the first thing I would explain to them, the HIPAA. And, that this is not going to be anywhere. This is solely for you. So let them know it'll be private. Also, you want to ask if they have insurance. I'll be honest, it's very hard to find a therapist with insurance. Horrible. Months and months of a waiting list, and then you're like, just forget about it, That's pretty much it. And then the brothers mentioned a lot of the other stuff, maybe relay your experience. Tell them somebody we have in our community, mashallah, a lot of good therapists. And you give them a choice, this sister, that sister.
Yeah.
Assalamu alaikum. We also came up with a strategy that might be helpful from previous experiences that we've had personally, and that would be to initiate a treatment plan, so to speak, to have the person to go in for a physical at first.
Nice.
You know, sometimes when you go in for a physical, the doctor can recognize that there may be other issues that are going on regarding psychological and mental health, and then they may be able to kind of guide that person to seeing someone, if not a doctor, then a social worker. So initially starting them off with a physical and see if they would be receptive with whatever the doctor recommends after that.
Nice. So you're taking kind of a step-by-step approach. They're not ready to enter the mental health and psychiatric field, but they're maybe willing to go see a doctor, like a family doctor.
Correct.
Right? And then kind of being able to maybe kind of soften this a little bit to allow them to get through.
Absolutely.
Tamam. Very nice. Two other main, very important concepts you brought up, so let's talk about them. One of them is confidentiality, privacy. This is something that is so common. I would say one of probably the most common thing that we hear about why not go get mental health support is confidentiality, where people wonder, because the Muslim community is only so big, that if they're going to talk to somebody, does that mean it's immediately going to be spread in the whole community, right? And then people worry, and they have very real concerns about if my kid goes and seeks out therapy, or they get a diagnosis, how are they going to get married, right? I mean, these are very kind of real concerns that come up very often. And this concept, you use the word HIPAA, right? And HIPAA, if you're familiar with HIPAA, it's basically the law in this country that does not allow for anything that's medical or psychiatric to exit that doctor's office. And so the medical records are protected, therapy notes are protected, everything that's meant to be protected. And then, because those of us who are mental health professionals, we are governed by a board that if we were to breach that, we would get our entire license pulled away from us. And so for ethical violation. And so professionals have trained very carefully to be very careful about confidentiality. So I always tell people, you can literally, all my, 15 years of school, gone like this if I were to breach confidentiality. And so that's very important for people to understand. And I know it doesn't like completely make people comfortable, but it should make them more comfortable, because the question is, well, depending on who I say it to, is my news going to spread to the whole community, right? So that is the difference between professional versus non-professional care, is one of the ways we kind of help them explain that concept. You also had brought up something really important as well. What was the second thing you said? It was confidentiality and insurance. Yes, thank you. That's what it was, the logistical aspects. And inshallah, later this afternoon, Dr. Amar and I will be covering a section on how to make your masajid more mental health friendly, potentially, and also very step-by-step referrals, basically how do you access the systems that have Muslims in mental health. And so I'm going to show some of that on the slides and also on the website to explain where are these directories, how do you take these next steps, inshallah ta'ala, so it's much more practical implementation of what we talk about today. Theory more in the morning, practical more in the afternoon, inshallah. Clarification? Yes. Confidentiality, clarification. Go ahead, yes.
Who's first? One moment.
Yes.
Saeed. You're the first one to be told.
I can repeat for him. So you're saying that one of the issues that come up in the community is that people don't want the session in the masjid, they want to take the session outside of the masjid. This afternoon, inshallah, we're going to be presenting a discussion on models of mental health. And actually, I have found over the years that I've been doing this, subhanAllah, that about half of our community have to have it in the masjid. Meaning the families, the parents, they're not going to trust it outside of the masjid. So we actually bring mental health professionals into the masjid. And then the other half of the community wants nothing to do with the masjid. They want to have this in the typical doctor's office. And so both models become very important, mashallah. And we'll talk about but that's a very good point, inshallah. Yes, clarification?
Assalamu alaikum. There is a point where the community in general need to be educated by the masjid and whatever, on home, promoting such seminars by mental health professionals, or just bringing people in, giving seminars and educating them about the subject.
Sorry, was that a comment? It was about bringing mental health professionals into the
Yeah, and
masjid.
it's part of
Sorry.
the solution. Before
Part of the
Amina
solution.
comes into the Imam,
Yes,
we need to
tamam.
educate the community.
Yes, I agree wholeheartedly. The concept of education being one of the key solutions for actually minimizing or preventing some of this from getting too far into the process.
Jazakallah khair. Assalamu alaikum. Just one more point to add, inshallah ta'ala. I think since Amina is seeking spiritual therapy or spiritual guidance, I think one other way would be to put, guiding her to a therapist in a spiritual context. Going back to what you mentioned in the beginning about the advice of the Prophet ﷺ to the Sahabi, to basically tadawu. If we put things in, because a lot of time what happens is that when families or individual come to Imams, they come because there's already a trust established. The Imam is a trustworthy person, and we hope we are, inshallah. So to basically take them to, or to refer them to someone else, requires basically the Imam to put what you're recommending into a religious context or a spiritual context, so it makes sense to the person. Because you could be sitting and talking, psychology and therapy in the modern context for hours, and then your session is basically down the drain. But as soon as you put it into the religious context, it will ring a bell in the ear of the person.
It does. It reframes it. Thank you. No, that's exactly right. And this idea of a warm handoff, because as Imams, you really are the frontline responders. Every study that we have done in our field of Muslim mental health, and repeat it again and again, we keep repeating this study again and again and again, it shows that after friends and family, Imams are the next in line for when people come to for support and help. There is some new research, it's not a lot yet, but there's kind of an emerging research that maybe generationally, that there's some difference of younger people starting to go more quickly to a mental health professional. All right, barakallahu fikum. It's always hard to interrupt a very good conversation happening. And the training specifically has these segments of having everybody discuss together, inshallah, and then coming back together as a group. The hope is that, inshallah, there's some direct putting theory and thinking of what's on the slides into some practice. So we would love to hear some of your thoughts of how you're going to discuss with Amina or someone like Amina, inshallah. Yes, bismillah.
Until we get the mic and speak clearly, and if they didn't express the question correctly, repeat it for us, please. Thank you.
Thank you. I'll begin that I will listen attentively to Amina first, give her all attention. Second, I will acknowledge that the courage that she came and talked about her issue. So I will dismiss the fear that she would have, and I said that's a good thing you did, and reaching out. And at the same time, I would tell her, your problem is not something unique. Actually, as you think this is because of your lack of spirituality, I can guarantee you that people on the first line of mosque never miss salah, and actually even some imams they went through as you're throwing even worse. So it's not something that because of a lack of spirituality. In fact, will be more close to Allah subhanahu wa ta'ala, be more tested, regardless that a jinn issue, as maybe would think, that position or ayn, or they think it's a mental, regardless. Even shaitan, he's not going to care about those going to nightclub, but care about those that come into the masjid. I would say them in the straight path. So I would try to, first of all, say, what going through, it's not because of, you are not doing enough and you're not really good in spirituality. Actually, will be more high in spirituality. You are facing more trouble, actually. However, you'll be more close to Allah. That will help you to tackle your issue. No doubt with this. Yes, so yes, you should try your best more, more dua, more other things, but has nothing to do with your problem. And that's the main point I have to clear out. And then I said, depends on her issue. I would try to refer to her to somebody, and I will do even further step, if made that connection to the community, because sometimes they will, listen to you and not taking action. So I do have in my masjid, volunteer committee that dealing with those from a professional people, psychiatric and others, that are willing to accept any person, that be referred by the imam. So I could, make that connection and go from there.
Thank you. That's great. So I like how you outline the different steps. There's an acknowledgement, there's an understanding of where she's coming from, also kind of a questioning, kind of like having a dialogue. That's very, very important point. Often we hear people say, I tried to have a dialogue, but I was immediately shut down, or I was given kind of an immediate answer, kind of like stamp, done. Whereas a lot of times they've been in their mind for so long grappling with this, and you said something very important about being brave to come forward and congratulating that person literally, because sometimes it's been years that they have been grappling with this over and over, and when they finally find the words to finally admit that they're having a hard time, sometimes they're immediately shut down, and then they don't never want to try again. So this is very, very useful. Thank you. Yes.
And also we were together. We also discussed validating the notion that your mental problems may not specifically be because of a lack of spirituality, by tying in what you had mentioned earlier about the Prophet sallallahu alaihi wasallam feeling some specific emotional distress, as well as encouraging the congregant member to seek help, just like the Sahaba used to seek help with the Prophet sallallahu alaihi wasallam. And the last thing would be, in an effort to help them or motivate them to go and actually seek therapy, would be to challenge the notion of why they have come to the conclusion, or specifically for Amina, how she came to the conclusion that that this is sihr and it's not something else, and can this be related to a lack of accountability?
Yes, very nice. Can it be kind of like externalizing it, putting it on others or other things, but what about turning inward and saying, could there be something that maybe that person is doing? And then figuring out when they're ready to hear that, right? Because it might take a little bit of work to get there.
Of course.
Of course. Very nice. Yes. Shall we go on this side of the room first, and we'll come back, inshallah? And then, sisters, you have someone? Yes? Excellent. Okay. Tafaddal. Yes. Oh, you're waiting for the microphone. Tamam, thank you.
Where am I going? Taken from this side first.
Assalamu alaikum.
Alaikum salam.
One of the things, I guess, was more structural, and it could be encouraging more tulabul ilm to enter the field of psychology. So there's like a pathway to referral, and it's not an abstract thing of like, go seek therapy, but you don't know what the steps are to which they could even get a first session, or who is that you're sending them to. And perhaps even having your own personal experiences with therapy. So then it's less of an abstract thing, and then more so you can say it's something I went through, and perhaps that could make it like, even if the sheikh has done it, perhaps it's not so bad after all.
Thank you for that. Excellent comments. Several things. The last thing you said is very, very powerful, which is the concept of personal experience or personal vulnerability. And this is something you have to decide if and when you're ready to share. You don't have to. But I've had many conversations of my circle. As I mentioned earlier, not only am I part of an ustada, kind of like woman who've studied circles, but also my husband's a sheikh, right? And so seeing kind of his world and everything that he holds and kind of carries, and fully understanding that there is a lot that all of you carry. That's just the reality of it. You carry a lot, tabarakallah. And the advice over time, and I know this from many of them, just connected to our network, many of those individuals actually are in therapy, but they're not necessarily ready to say that publicly. And sometimes I will say to them, when you are ready, you don't have to get up on the minbar and say, I am in therapy. But it could be in the middle of a conversation or in the middle of a khutbah you're giving, in the middle of something you might say, and in therapy, because such and such happened, or the therapist said such, and so people kind of connect the dots and realize this is a person who also is a human that needs support and help and assistance. And then it kind of almost like gives permission to the person, because if the imam is going, then it probably is okay to go, right? If somebody's hesitant about going. One time I was talking to a group of imams who had just had a crisis happen in their community. It was a very difficult time, subhanAllah. And one of them said to me, he was a youth director, and he said, I tell the parents of the youth that I work with all the time because I know that they need therapy, and the parents are usually one of the barriers. And he said, I say to the parents, I have friends who are Muslim therapists, and they're really good people. You should trust them. It's okay, so and so. And so I said to him, thank you for saying that. But how much more powerful would it be if you said to the parents, and I go to therapy? And he just sort of looked at me. I think I caught him off guard. But just to think about, kind of what that means when you put yourself in those shoes. If you're going to give that advice to somebody, what does it mean to practice it yourself? And the possibility, as I mentioned, mental health, and we're going to have this hour with Dr. Amar where we go through all the different diagnosable mental health conditions. But what about the other things that was in the umbrella of mental health, such as marriage therapy, family therapy, parenting? Aspects that may not be diagnosable, but absolutely potentially need some help and support. Does that make sense? Where's our mic for the sisters? We'll take another example here, and then we'll kind of move forward, inshallah. I don't know where the mic is. Oh, mashallah. Okay. Tamam.
Well, the brothers pretty much mentioned a lot of good ideas, how we would motivate her, and some of the things we came up with, like, yes, must be very stressful for you. How would you like to seek some therapy or talk to someone who is trustworthy, someone that you would be comfortable with, and explain to them, because there's a huge stigma with privacy. They think the minute that you propose this to them, you're going to go tell other sisters, you're going to go tell everybody. So privacy and trust in the community. So that's the first thing I would explain to them, the HIPAA, and that this is not going to be anywhere. This is solely for you. So let them know it'll be private. Also, you want to ask if they have insurance. I'll be honest, it's very hard to find a therapist with insurance. Horrible. Months and months of a waiting list, and then you're like, just forget about it, That's pretty much it. And then the brothers mentioned a lot of the other stuff, maybe relay your experience. Tell them somebody we have in our community, mashallah, a lot of good therapists. And you give them a choice, this sister, that sister.
Yeah.
Assalamu alaikum. We also came up with a strategy that might be helpful from previous experiences that we've had personally, and that would be to initiate a treatment plan, so to speak, to have the person to go in for a physical at first.
Nice.
Sometimes when you go in for a physical, the doctor can recognize that there may be other issues that are going on regarding psychological and mental health, and then they may be able to kind of guide that person to seeing someone, if not a doctor, then a social worker. So initially starting them off with a physical and see if they would be receptive with whatever the doctor recommends after that.
Nice. So you're taking kind of a step-by-step approach.
Correct.
They're not ready to enter the mental health and psychiatric field, but they're maybe willing to go see a doctor, like a family doctor.
Correct.
Right? And then kind of being able to maybe kind of soften this a little bit to allow them to get through.
Absolutely.
Tamam. Very nice. Two other main very important concepts you brought up, so let's talk about them. One of them is confidentiality, privacy. This is something that is so common. I would say one of probably the most common thing that we hear about why not go get mental health support is confidentiality, where people wonder, because the Muslim community is only so big, that if they're going to talk to somebody, does that mean it's immediately going to be spread in the whole community, right? And then people worry, and they have very real concerns about, if my kid goes and seeks out therapy, or they get a diagnosis, how are they going to get married? Right? I mean, these are very kind of real concerns that come up very often. And this concept, you use the word HIPAA, right? And HIPAA, if you're familiar with HIPAA, it's basically the law in this country that does not allow for anything that's medical or psychiatric to exit that doctor's office. And so the medical records are protected, therapy notes are protected, everything that's meant to be protected. And then, because those of us who are mental health professionals, we are governed by a board that if we were to breach that, we would get our entire license pulled away from us. And so for ethical violation. And so professionals have trained very carefully to be very careful about confidentiality. So I always tell people, you can literally, all my, 15 years of school, gone like this if I were to breach my breach confidentiality. And so that's very important for people to understand. And I know it doesn't like completely make people comfortable, but it should make them more comfortable, because the question is, well, depending on who I say it to, is my news going to spread to the whole community? Right? So that is the difference between professional versus non-professional care, is one of the ways we kind of help them explain that concept. You also had brought up something really important as well. What was the second thing you said? It was confidentiality and insurance. Yes, thank you. That's what it was, the logistical aspects. And inshallah, later this afternoon, Dr. Ahmad and I will be covering a section on how to make your masajid more mental health friendly, potentially, and also very step-by-step referrals, basically how do you access the systems that have Muslims in mental health. And so I'm going to show some of that on the slides and also on the website to explain where are these directories, how do you take these next steps, inshallah ta'ala, so it's much more practical implementation of what we talk about today. Theory more in the morning, practical more in the afternoon, inshallah. Clarification? Yes. Confidentiality, clarification. Go ahead, yes.
Who's first? One moment.
Yes.
Saeed. You're the first one to be told.
I can repeat for him. So you're saying that one of the issues that come up in the community is that people don't want the session in the masjid, they want to take the session outside of the masjid. This afternoon, inshallah, we're going to be presenting a discussion on models of mental health. And actually, I have found over the years that I've been doing this, subhanAllah, that about half of our community have to have it in the masjid. Meaning the families, the parents, they're not going to trust it outside of the masjid. So we actually bring mental health professionals into the masjid. And then the other half of the community wants nothing to do with the masjid. They want to have this in the typical doctor's office. And so both models become very important, mashallah. And we'll talk about but that's a very good point, inshallah. Yes, clarification?
Assalamu alaikum. There is a point where the community in general need to be educated by the masjid and whatever, on home, promoting such seminars by mental health professionals, or just bringing people in, giving seminars and educating them about the subject.
Sorry, was that a comment? It was about bringing mental health professionals into the
Yeah,
masjid.
it's part of the solution. Before
Part of the
Amina
solution.
comes into the imam,
yes,
we need to
tamam.
educate the community.
Yes, I agree wholeheartedly. The concept of education being one of the key solutions for actually minimizing or preventing some of this from getting too far into the process.
Assalamu alaikum. Just one more point to add, inshallah ta'ala. I think since Amina is seeking spiritual therapy or spiritual guidance, I think one other way would be to put, guiding her to a therapist in a spiritual context. Going back to what you mentioned in the beginning about the advice of the Prophet ﷺ to the Sahabi, to basically tadawu. If we put things in, because a lot of time what happens is that when families or individual come to Imams, they come because there's already a trust established. The Imam is a trustworthy person, and we hope we are, inshallah. So to basically take them to, or to refer them to someone else, requires basically the Imam to put what you're recommending into a religious context or a spiritual context, so it makes sense to the person. Because you could be sitting and talking, psychology and therapy in the modern context for hours, and then your session is basically down the drain. But as
Agree.
soon as you put it into the religious context, it will ring a bell in the ear of the
It
person.
does.
basically.
It does. It reframes it. Thank you. No, that's exactly right. And this idea of a warm handoff, because as imams, you really are the frontline responders. Every study that we have done in our field of Muslim mental health, and repeat it again and again, we keep repeating this study again and again and again, it shows that after friends and family, imams are the next in line for when people come to for support and help. There is some new research, it's not a lot yet, but there's kind of an emerging research that maybe generationally, that there's some difference of younger people starting to go more quickly to a mental health professional. Study again and again, it keeps showing the same thing again and again, which is why we have all this emphasis on imams trainings, because one person, one of you, is going to potentially touch the lives of hundreds, right, of people, subhanAllah. So let's kind of wrap up this discussion and also the discussion on Amina, or any individual who thinks that it's purely a spiritual problem. And mashallah, you have had many ideas that have come through. And so in summary, to acknowledge, right, it's very important that both spirituality and spiritual practices can be and should be part of the solution. To draw from that Islamic history of psychological healing practices, including a hadith of the Prophet ﷺ that he tells us, go get help and support, right? And then the non-judgmental, open-ended questions to find out more about their hesitations, as opposed to kind of giving them a blank statement, a kind of blanket statement that covers everything, to really have more of a dialogue to see where they're coming from. So I hope, inshallah, this was useful kind of exercise in thinking through, and also kind of in our own kind of moving some of the cobwebs for ourselves kind of on this thinking, inshallah ta'ala. Now, at this point in time, we have the third module, inshallah. I just want to check in with everybody if we're good, because we're going to go a little bit deeper and a bit heavier in the next conversation. Doing okay, inshallah? All right, inshallah ta'ala. So this next part of the conversation is about crisis intervention, and I mentioned the word earlier, suicide or suicide prevention. And typically in the field, we do something called the trigger warning, which means that I'm going to be sharing some heavy and difficult things. And I realize that different people here have been affected by different points in their life, potentially, or people they've dealt with. So at any point that you feel that this is a little bit heavy, please give yourself some space, inshallah ta'ala. I want to take a moment and talk about this because it has become much, much more apparent. As I mentioned, over the years that I've run Muslim mental health clinics, it has been really apparent that there have been more and more points of people saying that they're feeling suicidal, or as clinicians, we're actually finding that they have attempted suicide. And then, of course, there are the unfortunate cases where a person has actually died by suicide. And as I mentioned earlier, I'm sure many of you have even done a janazah or a burial, or at least are familiar with somebody who has died by suicide. The problem with this whole discussion, and this is why it gets heavier, is because, and this, I mean, I'll tell you, as somebody who both trained in the Sharia and then also trained in psychiatry, even I didn't feel that I was ready once we had the first case in our community years ago. I did not feel that I was equipped or ready to really help the community heal and grieve from what was happening, but also make it very clear the stance of Islam on this topic, right? The reason that paper that we were talking about earlier becomes really important is at what point is a person rational to be, like you said, culpable? Yani they're going to be held accountable for this decision that they've made, versus they were in an irrational state of mind, and therefore Allah in His mercy may forgive. Allah Ta'ala alam, that's only His ability to judge. And what does that leave us as a community? Because the reality is, for so many of us, I think, like for many of you, growing up, I would hear people say, there is no janazah for a person who died by suicide. What is this? Or people, families, multiple in my mind, my memory, who couldn't even find a burial plot in the Muslim section of the cemetery or the Muslim cemetery because people didn't want that person there, and the family literally had to go take them and bury them with the non-Muslims. There is a lot of stigma on this very topic, and I want to be very clear. Please, everybody, mashayikh, please. Please, nobody walk out of here saying that Dr. RANIA said anything except that suicide is haram, when done rationally and with full understanding. Where there is some gray has to do with at what point in those last moments was the person no longer rational. And at that point, who are we to actually put judgment on their akhirah when we don't know our own akhirah? And so this is where the discussion comes in of how do you help support somebody who is feeling suicidal? How do you prevent it from even happening? How do you intervene to actually help them and support them? And then if there is a death by suicide in a community, what do you do in what we call post-vention, meaning the intervention you do after the crisis has happened? How do you pick up the community again and help them heal? And so I'll also preface before I go into this set of slides, is this is very short. There are just a few slides here to kind of touch on the story. But there is an entire training that we do that's actually as long as today, like an 8-hour full day training, certification training on Muslim suicide response that we offer through Madistan. And it's actually something that my lab worked on for about 3-4 years, actually writing a manual. That's the only one that we wrote it because we couldn't find anything like it. That was basically bringing all the fiqh, basically all the ethics and morals of the Islamic faith, and then bridging it or tying it to the modern scientific understandings of suicide and psychiatric illness. So that's about 100 pages. But then we realized we couldn't just give our dear Imams 100 pages and tell you, now do something, please. We realized we had to take the manual and turn it into a full day training. And so, alhamdulillah, we've been doing these trainings across the country, and we hope maybe one day to come close by to you or to your masajid, ibnillah. For today, I just want to touch on this topic in brief and give some pointers of what are the things to do, and then maybe in the future kind of follow up in a longer training, inshallah. So what is a mental health crisis, this word crisis that we keep using? And this is a situation at any point where a person's actions, feelings, or behaviors can lead them to a point of hurting themselves and or others, or put them at a risk of being unable to care for themselves or function in the community in a healthy manner. When a person reaches a point of crisis, they're no longer at this point of rational. You're trying to talk with them and you really can't reason well with them at any point at that point. And when you try to tell them, why are you doing this? Like, why are you hurting yourself in this way? There's so many different answers they may give you, but often it's not something that you're not talking to the person who you once knew as being a rational person. And it could be triggered by what? By certain things that may happen in a person's life, unaddressed stressors that may accumulate over time, or it could be one big thing that happens suddenly. So for example, a person loses their job and they realize that they can't support their family, and maybe they were supporting other family and so on overseas and so on and so forth, and they just kind of go into this crisis moment. It could be something related to school or to family or to relationships or to health problems or to financial difficulties. And as much as we want to tell that person, and we should tell that person, Allah's going to see you through this and help them kind of take the steps and tools, when a person reaches a mental health crisis, they may not be fully able to even hear you. No counseling begin. Or maybe they overlap. There's like a Venn diagram where they overlap one on top of the other. But there's definitely a section here that is people who have become mental health professionals have trained for years, literally for years, how to talk to a person in crisis, how to talk them down literally off the ledge, right? How do you talk that person down? And that's a lot of training to get to that point. And the point of me saying this is that there's absolutely a space and time for the work our spiritual leaders do. But there's also a time to refer and to get the help of a crisis counselor, somebody who's able to help you right in that moment, so that we don't have people getting to the very end of that line. So this is where I'd like to show you the steps or the signs of distress and go through each one with you, inshallah. So let us start with the calm. The calm is the normal state of being, which I hope many of us are sitting in this room in that space. But then something may trigger it, as we mentioned earlier. It could be an accident of some sort, a stressor of some sort, a health issue of some sort. Some of the recent cases that reached the news that were part of the Muslim community, as you know, that a person may have taken their whole family. We've been hearing, unfortunately, of these murder-suicide cases, and then people try to give an example of why such a thing happened. And I know one happened very recently here, not too long ago, or in Texas, not just so many weeks ago. And, the people said, that there was a drowning of a young girl, a young daughter right before this, that triggered this thing to happen. And Allah Ta'ala alam, but it very well could have been a trigger. And the reason I mention that is it's not rational sometimes. It may not be 1 + 1 = 2, the way it is for you, right? It could be that there may have been a long-standing issues and then suddenly something really kind of flipped for that person. So what do? Well, from the point of a trigger, you get to the point of agitation. And in agitation, this is where you see emotional responses. It could be anger, it could be crying, it could be frustration, or it could be social withdrawal. And this is where we say in that longer training that I was telling you about, we encourage people. You know, if you have people who you know pray in the front wall, you know, the lines of your masjid all the time, unless they're traveling, they're always there. And then they just disappear for several weeks or months. That's abnormal. Something has happened. Maybe they found another masjid, maybe, but maybe there's also something that happened. And the fard kifaya, right, the communal obligation to be able to say, to turn and say, where is Fulan? Let me call them and check how they're doing. And then you might find out that maybe, yes, indeed, you know, a family member passed away and they've been really depressed because of it and they've been withdrawn. And in that moment, you just want to sort of, if we can help as much as we can help, to have that kind of collective checking in on each other, there may be a benefit, of course, as well. When a person reaches the point of agitation, the next point up, and you see it's in red, right, is acceleration. Because up until 1, 2, and 3, I would say all of this is normative. We all go through this, all of us. But number 4 is where things start to get abnormal. This is where you reach high intensity behavior and emotion. Like the question that was asked earlier, like, could there be such a high level of anger, right? Could there be such a high level of, you know, kind of behavior that it's no longer normal, it's pathological? Yes, and that's kind of where we're worried about. Either it's irrational or it's something that's frankly just dangerous altogether. And if you continue to let it go, you reach eventually the peak. And the peak here being the behavior that you reach this level where they're now potentially a threat to others and themselves. And they may be not, like you asked the question earlier, they may not even remember this. Now, as a psychiatrist, having seen patients like this, I can't even describe it to you. It's very, you know, I will say to a person who's in a manic state, who's cursing and cursing and cursing, you know, and then the next day after they took their medications and kind of calmed down, I'll say, do you remember all the things that you said? You said this, and you said this. Yeah. No, I didn't say that. No, I didn't say that. No. You know, and no memory, like done, like completely not there. And then you realize, subhanAllah, how the mind is fragile. Allah gives us this mind, but when it's not well, it's amazing how different it functions, right? SubhanAllah. I'll be showing you a very short YouTube clip. This is September, SubhanAllah, and September is Suicide Awareness and Prevention Month. And I have a request from all our imma here, and our khatibs, and all the sisters who may ghostwrite the khutbahs, or can actually influence and make sure that khutbahs are made. My request, and you'll hear me say this later again, I hope that in this month of September that at least one of the khutbahs of the Fridays of this month are on about suicide prevention. It's something that actually does need to reach the point of discussion in the community. And people worry about, if I say this, will I put thoughts in someone's mind that's not there? Every research study has disproven that. In fact, what we know is the strongest part of suicide prevention is education. And there's nothing as a captive audience as your khutbahs, subhanAllah. They're all there, subhanAllah. And you give your warnings, and we actually have written, one of the shuyukh, he's not with us today, but he actually wrote the entire khutbah that is downloadable, free. I'll show you the website, it's right there. Download it directly. If you don't want to write your own, it's already written for you. The khutbahs. We have one on suicide prevention and one on suicide postvention, in the aftermath of a suicide. And the reason I'm doing this, and I'm really pushing this, is because this is part of the goals of prevention. One of the stories that you're going to hear me say on the YouTube clip coming up soon here is one of our own shuyukh. And this was when it really like hit home for me. Somebody who, and I'll talk about this on the video where it's, you know, what can I say? You know, he was the sheikh of the shuyukh. I mean, the top teacher, right? But none of us students knew that he had mental health condition. It wasn't clear or obvious, and as students, you don't pry into these things, of course. But when it really reached its peak, subhanAllah, we had to have him on suicide watch. Yani, there was somebody with him 24/7, and this is where I'm sharing heavy stories, so please take a moment if you need to. But the number of 2 or 3 times that somebody literally pulled him off of the balcony. This person, Hafid al-Quran, a mufti, literally the sheikh, other shuyukh would describe him as an ocean of knowledge. It's not his knowledge or lack of iman or lack of prayer or lack of anything. He had a biological condition. And later, when we said to him, Sheikh, yani you went to the, yani you attempted, yani it's so hard to say that, yani, no, I never did such a, he couldn't remember. Khalis, like gone completely. So in that moment of irrational thinking, you may do something to hurt yourself or someone else and not even remember it later. And this is where the hadith that talks about the pen is lifted, right, is powerful. Because there are times where the pen truly may be lifted from someone who truly may not remember or be rationally present with me and you, even though they seem like they're present with you, but they're not. Right? And because mental illness is inside, you can't see it physically, like when someone has a disability, their arm is broken, their leg is broken, you can see it. Here you can't see this. And so it's very hard sometimes to even believe it. But that was when people ask, why are you talking about suicide so much? It was actually this experience that started the process for me. Because I was like, well, if the sheikh of the shuyukh, this could happen to him, then it obviously can happen to everybody, anybody. Yeah. So he did seek out treatment. And he did get much better. He's now passed away, Allah yarhamu, not from suicide, but he's passed away natural death. But I mean to say, he did actually go get mental health support, psychiatric and therapy, and physical health. He also had some physical health conditions. And the end of the story is he actually got better from some of these aspects. He continued to be, there's a chronic illness, so he's, continued to the end of his life to have some chronic conditions, but not to the peak points again. Alhamdulillah. The reason I share this is because intervention does actually work, and medical care does actually help, right? But I think sometimes we are in denial, and then we think that somehow those who are more religiously connected are immune to this. That if it runs in your genes, it runs in your genes. What are you going to do other than when it pops up to actually get the support needed, right? SubhanAllah. It was a heavy thing for all of us to experience. I'm coming to, inshallah, I'm going to show it very soon, the website. Let me first give a couple of definitions just to define the terms I'm using here and to be clear. There is the term suicide that we've been using, which is self-inflicted injury with the intent to decease or to kill oneself. Whereas a suicide attempt is self-injurious behavior. You may or may not have the intention to hurt oneself. When we talk to young people or just people who do self-harm, like cutting and so on, they may not necessarily want to die, but they may be doing so because they feel so numb that cutting or seeing the blood makes them feel real again. Or it may be a sign of distress, like a red flag, help, right? Or something else that may be happening with them, but they don't necessarily ask them, was this your plan to die? And they say, no, I wasn't planning to die, but they're not well, right? But of course, the more attempts that happen, the more likely that one of those is going to succeed, and they will die. And then suicide ideation is this term that means thinking about suicide or considering it. This is when I sit with people and they say, I wish I didn't have to wake up tomorrow morning. I'm better off dead without my family. My family's better off without me. Kind of this kind of language, but then you ask them, do you have a plan? No. Are you intending to die? No. Did you ever plan out 1, 2, 3? No. They just have thoughts. But the problem is ideation can lead to attempts, and attempts can lead to death by suicide. That's kind of the concern here. So for us in the field, the mental health field, when somebody starts with ideation, we take it very seriously. Even if they're young and even if you feel like they're being dramatic, we actually take it very seriously because one wrong move and they will be dead, right? So this is where, let me tell you kind of now what to do about all of this that we talked about. So what to do if somebody's having these suicidal thoughts, a couple of steps. The crisis response line is a non-Muslim line, okay? It's run by the US. And it's a 24/7, this is why I'm mentioning it. They used to be a 1-800 number. And every time I'd give talks to young people, I'd have them actually put the 1-800 number in their phone. But last summer, the US government changed it to 988. And they changed that because it's not calling 911. You're not calling law enforcement. You're actually calling a crisis center where people are trained on crisis response with pickup, and they can help them talk through the crisis. And if they find them very problematic, they will get an ambulance to them, right, to take them to the emergency room. But 988 is open 24/7. We do have Muslim ones, and I'm going to show it to you on another slide, the Muslim crisis lines, but to my knowledge, none of them are 24/7 yet. They're open some hours of some days, which is good, but if you need it in the middle of the night or something, 988 is going to be there for you all the time. So please know this number. And then also to know, please, if you happen to be the person who's with the individual, please don't leave them. Just sit with them. You might have to cancel things to make sure that you're sitting with them until they can be taken to emergency care. Sometimes we don't know what to do, and so we're just kind of giving these steps. Number 3, if they're willing to seek out the services prior to this attempt, referring. Now, a lot of people at this point think, let's refer to the mental health professional, but most mental health professionals are not acute care. They don't take on crisis response. They're doing things like, outpatient therapy, but they're not crisis acute response. The only place that does crisis acute response is the emergency room, right? Because they always have a psychiatrist on call 24 hours a day. And so when you don't know what to do and it's right there, where are you calling or where are you taking them to? It's the emergency room. And as much as people don't like that, the reality is you don't want to regret later this person dying, right? So there's just these important kind of clarifications. Sometimes we think, okay, let me call my therapist person in the community. They're not going to be able to help you right in the crisis moment. Maybe they can see that person after they stabilize, but they're not crisis, that's not their practice. Their practice is aftercare. Does that make sense? So the do's and don'ts here related to suicide, and we have several articles that I'll show you that you can click and use and send to your community if you wish on the website that I'm going to show you. It's on Medicine. It's called Muslim Suicide Response. And the do's and don'ts. So we talked earlier about empathy and avoiding language with stigma, encouraging behavior, like there's no shame in seeking support, acknowledging that suicide is complex, and also being supportive and offering the validation. This may all seem very standard to you, subhanAllah, but I can't tell you how many times I've had either an imam or an ustad that literally working with somebody and they're like, they get just stuck, or they're at the house. I've had this happen a few times, at the door of somebody, and they call me and they're like, I don't know what to do. I feel like I'm losing my words. And so sometimes it's just helpful to kind of lay these steps out, and not using shaming language like, oh, they gave up, or oversimplifying it. Like if they just prayed more, they'd be better, right? Or they didn't have enough faith, so on and so forth. So here's my exercise for all of you now, inshallah. This exercise has to do with what happens after a suicide happens in the community. So you are the khatib, you're getting up and giving your khutbah, right? And I've had this happen a few times now where, subhanAllah, the suicide in the community happens on a Wednesday or a Thursday or something, and you, just a couple days later, you're going to be up on that minbar. What do you say? And how do you console the community? So what to say versus what not to say, right? So this term here, sometimes Muslims say it, often we hear it with non-Christian communities, right? They are in a better place now. Why is this problematic, and how do we reshape this? Yes? Allah knows best. Oh, you're encouraging potentially. This is a really good point. When the person who is seen as the religious figure or leader stands from a place of power, literally the minbar, and says something that seems not problematic. They say they're in a better place. It sounds even okay, but the reality is it goes against, first of all, what you said here, which is our own aqidah on this. Like, we don't know that they are in a better place. We don't know. Allah may have forgiven them in their mercy if they were in that irrational state, or they may actually not be in a better place. We don't know, subhanAllah. So it's not even factual. And then here you were saying that you may be giving permission without realizing it. So without even intending it, inadvertently, by saying that, you don't know who's in this big crowd of the audience that you're speaking to, who may, subhanAllah, interpret that as, well, if the Imam said that that person is in a better place, then maybe I can be in a better place, And subhanAllah. And so they kind of really encourage people not to use any terminology like this. It doesn't even work for us as Muslims, because the Christians use it more often than us. But even with us, you don't want to ever say something that can imply that somebody else in the audience can be triggered by it, right? If that makes sense. So how about we say instead something like, when you're trying to kind of help the community or help the family, for example, that lost this person, to say something like, and you can use your own words, I can't imagine what you're going through, but I'm here for you, is a very powerful statement, because you can't, unless you too have had someone die by suicide, it's very hard to really imagine that kind of loss. It's not a simple death. It's a death where that person goes through and thinks about every interaction. What did I do? What did I say? Where could I prevent it? They kind of do a lot of self-blame, so it's so heavy. But when you say to them, I'm here for you, right? It's a powerful statement too, that you're not shunning them, because their fear as a Muslim community is that the whole community is going to ostracize them, right? Because this family member of theirs did this haram thing. How about this one? It sounds okay, but why is it problematic? Let me know what I can do. Okay, it looks like a cliche to you. Yes. What, you know what you want to do? What is that? Oh, you may not, the person may not know what they want, what they need right in that moment. They're grieving. Okay, good. So then what do you do instead? How do we reframe this? Nice. Very nice. Did you hear the sister, mashallah? Give a clear suggestion of what that is. So for example, I know you have a lot on your mind. If you need, and then you specify what it is. Do you need me to go drop off the kids? Can we organize a meal train for your family? Is there something that I can go pick up from the grocery store for you? Very specific, because when a person is grieving, they're not even necessarily thinking. And then when it's not organized, as you know, they end up with like 15 casseroles, right? And there isn't really help, and what they really need help with is someone to take care of the other kids for a little while, right? Something like that. So sometimes just being very specific is much better, inshallah. And so this is the training that I was telling you about the suicide response. It is a full day training. It's 4 modules where you have a portion of it is on introduction, and it's specifically designed for the Imams, right? It's the faith leaders, both men and women, our ustadas, our Imams, our shuyukh, but also chaplains, and also anybody who's on the front line. So Sunday school teachers, people who are youth directors, youth leaders. It's very important that anybody who deals with people directly have some level of training on this. At least one member of your community, inshallah. We hope it's more than one. And then there's prevention, intervention, and postvention, as I mentioned, is the write-up for the training. And then I'd like to show you, as I mentioned, this clip quickly, and I hope it works. One of my earliest experiences with the topic of suicide was actually the suicide attempt of one of my own teachers of the deen. He was an incredibly versed scholar of Islam, a mufti and a hafiz of the Quran. We students were shaken to the core. We could not fathom or understand how someone who was so learned in Islam could attempt to take his own life.
During the pandemic, I was contacted by a grieving parent asking me if I was willing to say a few words at her daughter's eulogy. Her daughter, at the age 16, had died by suicide.
A few years ago, one of our daughters, who attended a local private Islamic school in the area, took her own life. Her desperation led her to believe that there was no way out. She was beautiful, smart, feisty. She was 12 years old.
We cannot afford to pretend that this is not a problem in our community, or we cannot assume that this belongs to one demographic in the community. This is not a problem that is restricted to any particular age or any particular circumstance.
There is such a thing that a person is battling with suicidal thoughts, ideas that come that are not necessarily stemming from a lack of faith. No doubt, good faith and good family and good friends help, no doubt. But there is still such a thing as depression.
I want all of us, to work together to end the stigma of mental health, to provide the help that our children need, especially young people.
We have to refer people who are struggling, not just to the local imam, but also to train clinicians and therapists who can intervene medically and clinically.
I encourage all of us to use 988 and have our community members, loved ones, and families do the same right in that moment of need.
988 offers 24/7 access to trained crisis counselors who can help.
If you need suicide or mental health related crisis support or are worried about someone else, please call or text.
To reach the Lifeline, people can call or text 988 or chat online at 988lifeline.org.
So this effort of having some of the imams and leaders of the community kind of come together to do this particular clip was with the U.S. Department of Health and Human Services, the organization that's kind of that rolled out the 988 number from 911 to 988. And part of this effort was really because they identified certain communities that were minority, marginalized, potentially communities. And the first video they did was actually for Black churches, because that too was a place where there was definitely seeing an increase in suicide deaths, but no one willing necessarily to talk about it in the Black community or the Black church community specifically. And so that was their first video. Ours was the second. And after that, they've done this for other communities. I think they just did a Hindu one recently and so on. And so the reason that this is the case, subhanAllah, is because we have found that over the time that we've been doing this kind of work and research, it's been actually quite hard to explain to our communities the importance of this. It's not been the easiest conversation necessarily. I call suicide the taboo within the taboo, right? So the bigger taboo of mental health, and this is the taboo within the taboo. And what I am very happy to say to you, though, subhanAllah, is that in the last several years, you've been seeing kind of more willingness to have these kind of conversations and even these trainings. And I do pray, inshallah, we have a new study we're working on at the moment, of really trying to make correlations between a question you brought up earlier, which is where it's like, have you ever heard a khutbah in your masjid or a class in your masjid, a lecture on mental health or on suicide in Muslims, right? To see the correlations between that and between the rates or the numbers getting better, inshallah. So you are part of the solution, everyone here. You're literally part of the solution, inshallah ta'ala. And I wouldn't be advocating for it if I didn't understand the research of realizing that this actually is part of the solution, is the education around this, inshallah ta'ala. So in closing this kind of section, a couple more things that I wanted to share, and then we'll have a little bit of time to discuss, inshallah, which is how do you prepare for crisis? Part of it is knowing how to identify the crisis, like the steps we just talked about, being able to give people easy, accessible coping strategies, and then how to keep a person calm and safe. And that's kind of gist of the whole training that we have planned for you, inshallah, in another one of these. But really making sure that you have some strategies in your masjid. And so somebody brought up, for example, who are the local mental health professionals of your community, right? Also, what are the crisis? There's also something called crisis units or mobile crisis units that go out to different communities, knowing and having the numbers for you as a leader on hand of having that. So if something happens, you know where to go. We've also created a model of how do you do the crisis healing circles after a death by suicide in your community. We actually have written an entire paper on this step by step by step. How do you do this, right? Which, inshallah, we're happy to send you. Maybe there's a mailing list after this, and we can send you these papers and resources, inshallah ta'ala. Part of this also is understanding that needs to be a safety plan that is created in every community, and understanding what the triggers are, but then also understanding what you can do to support. So step number one is what you're doing today, learning what the mental health conditions are, learning what the crisis signs are, what the red flags are, so you know when to intervene and what to do for intervention. Number two is coping skills, both for yourself, because people sometimes in that moment get very themselves, their heart starts beating really hard and they don't, they need to kind of get hold of their own self. And then also how to keep everyone else calm when a mental health crisis is potentially happening. Third part of this, and again, in that bigger training, and we talk about making sure that you have the emergency contacts, right, of the individuals that you trust in the community and the mental health services. And, hang on, that's the next one. And then from there, we will actually talk to, I think it's in another one of the slides, inshallah, towards the end, where we give all the resources. I'll have a slide that has all of the Muslim crisis lines in addition to the 988. So that way you have different resources that you can look to, inshallah ta'ala. Yes, sure. So with that, this is, again, I mentioned very, very shortened, the 8 big hour training, very, very shortened. But just I wanted to touch on this to make sure that we talked about it a little bit and then give you a little bit of time to ask some questions that we can have a discussion on this in the time remaining before we switch to the next topic, inshallah, and go through the exact illnesses and their red flags. Okay.
I'm holding the mic.
You're holding the mic. Bismillah.
I'm going to start, inshallah. Jazakallah khair. A few things really quickly. It's kind of a running joke now that community members say, don't talk to the imam about your problem because it's going to be in next week's khutbah. So just a reminder to all of us that see people with family issues or personal issues to make sure we're, taking out the context enough that they're not going to be identified. The other thing, we had in our community a couple cases, but one case in particular, a person came, they had been seeking, they had been seeing a Muslim therapist for quite a while, but then their parents stopped them, one saying that it's not beneficial and they wouldn't pay for it, and the person was suicidal. And so I told this person, apply for zakat and put my name, tell them to call me if they need me. And there was some pushback. They didn't want to issue the check. I said, no, if this was cancer or this was, you would issue it for other things. But this person is literally in life, this situation, she needs help. So for those of you at Masajid that have zakat departments, and we need to put our foot down sometime and use our, what a little power we have as imams in our communities to help our community.
Allah barak feek. Wa iyyakum. Perfect, mashallah. In fact, one of the things that we'll talk about in the afternoon about models within masajid, or how do you make your masjid more possible to be more of a care, protective community, inshallah, is exactly what you mentioned. And I'll mention, in fact, you could see the little zakat button right here on the side. But we have actually figured out with all the rulings related to zakat, how do you use pools of zakat for those who are zakat eligible in the community to then allow for it to become mental health services. So in the organization that I run, Medistan, for example, the model there is you have insurances, so we take all the private insurances, but we also, this is in the state of California, so just mention all the private insurances, but then we also have the sliding scale for those who don't have the insurance or we don't take their insurance, for example, and then you have the zakat model or the financial aid model, and it's powerful. I mean, that way between that whole service line, you're able to pretty much everybody in the community can pretty much access mental health support. But using zakat it's such a creative thing. People haven't even thought about necessarily using the zakat funds to help with healthcare support, such as mental health support, especially when it's very difficult to access. And I'll present a couple models from different places across the country that have done this and done it well. MashaAllah, it's been running for a while. So that way you can get some ideas, inshallah, and maybe even share with each other some of the ideas that you all have already been doing. MashaAllah ta'ala. Yeah.
Assalamu alaikum. Right here. So, the Shura Council of Southern California has started an association for mental health professionals. And inshallah, we're having our first retreat at the end of this month. And one of the things that we believe that we need definitely to work on is to make the Muslim hotline, suicide hotline, more available.
Yes.
Our fear of referring people who have suicidal thoughts to these hotlines is that some of them, many of them, come from an evangelical Christian churches, and they have an agenda of believing Jesus or something like that.
Not the 988 though. That's a national line.
That's the national. Okay, I'm talking about the other ones.
Mm-hmm.
And then the other fear that people have about, I don't know if it's this one or others, is that they will. I don't know how they look at affirming gender identity, because that's one of the reasons that people would call, like, I feel this way, my parents would not accept me, I feel I want to kill myself. And I don't know what's the guidelines they have when someone calls that way, and that's the biggest fear that parents have and imams have, to refer people to hotlines like this. So what's your thoughts on
No, you're
our
absolutely right. I
concerns?
think I can't wait till we get to a point of having a Muslim crisis line that is 24/7. The reason, so I've talked to several, because there's about 5 or 6 I'm going to show you. Every single one of them will tell you the same thing. They don't have enough funding to staff 24/7 support. So this is another thing of like, alhamdulillah, we put a lot of resources. We're a very philanthropic community. Mashallah, we donate a lot, and Muslims are very generous, as the research always shows. But our resources tend to go to certain things. Mental health has not been one of those buckets. And so when we start to shift some of the resources to things like mental health, then we'll get a 24-hour Muslim support line. Do you know what I mean? So I encourage that strongly. I
So
hope we get there.
the second concern, do you have any thoughts on that?
About the Muslim lines or about non-Muslim
The
lines?
non-Muslim lines.
Oh,
Well,
yeah, subhanAllah. I mean, that's always going to potentially be. I will tell you one thing, because I don't know all these different lines and who's on them necessarily. But what I will say is if it's a true crisis, they're not going to be sitting there talking about gender identity. They're going to try to get them from point A to point B, right? And make sure they don't kill themselves that night. Do you know what I mean? Like, that's really the point of crisis lines. Could something else happen? Allahu A'lam. I mean, it's possible. It's possible. I don't know where the mic is. I think you have to pass it to each other. Yes.
Assalamu alaikum. So I'm an imam and also in the field academically and clinically. One of the, as we're talking specifically to imams, one of the known factors of prevention is fear of going to hell for both Muslims and non-Muslims. So there seems to be a narrative that, like, oh, it's insensitive to talk about those numerous narrations and we just kind of skip over that. When in reality, that is a protective factor. So if we don't educate young people or others about these narrations, then we're doing a disservice because then they have no idea what's going on. And certainly suicide, it didn't just start. You know, in 2014 at Masjid I grew up in Southern California, there were 15 janazas just in that masjid 9 years ago. So we also don't want to lose perspective. I'm now in that neighboring masjid where there was that murder-suicide in Allen. We have community members that go there, they come here. So, of course, and I'm not downplaying it or saying, you know, to ignore it, but there's a whole lot more addiction and marital problems and 15 other things versus how many are committing suicide as from percentage angle. So again, I'm not by any means saying it doesn't exist or it's not there, but we have the ability by educating to prevent in the first place. And when we're looking at our resources, we want to make sure we're sort of looking at the whole picture and not just you know, something that's being discussed a lot or something that's currently in the news.
Yeah, and the prevention part is a powerful kind of statement. This concept of, and this is where in the training we kind of really try to delineate what's what. So we say, look, in prevention, this is definitely a time to bring up all the ahadith and the ayat of the Quran that speak directly to suicide being forbidden and it being a sin. I can't tell you how many patients I've had in clinical practice who have said to me, if it wasn't for Islam's prevention of suicide, I would have died by now. I would have done this by now. I'm worried about going to hell. I'm worried about my akhirah. And so that's powerful. And that is very important in the prevention discussion. However, that part, this is what we do in our training, we explain how that discussion is not necessarily time for that discussion in postvention. When a community has now had somebody die by suicide and everyone's grieving and in a lot of distress, that is not the time for that right then and there. There's a time and space, just like the Prophet ﷺ used his wisdom of one to say to what? And one Sahabi, two people would ask the same question, they'd get two different answers, right? Depending on the state of that person. And so it's really important, of course, we don't have that kind of level of wahi, but we have wisdom and hikmah, right, to use of what to say when. And so the training kind of delineates what to do at what point in time. As to the point of, are there other issues that are much more prevalent in our communities? Absolutely. In mental health, the end of the line is suicide. And so this is where you're trying to absolutely get to the prevention of, like, we don't want to get this far down. And this is, of course, the one that kind of like causes everybody to go, oh my goodness, right? Like, oh, this terrible story, right? And so the attention is sometimes really related to a lot of the national kind of headlines that unfortunately Texas here has made national headlines multiple times, unfortunately. And the reality is there is a lot of, like you were mentioning, underlying issues that led to that in the first place. Mental health, but also other issues too, family issues, addiction issues, as you mentioned, right? So what do? You actually need programming about all of them. I mentioned September because it's the month that we're currently in, but also You have October, which is General Mental Health Awareness Day, isn't it? You have March, which is a whole Mental Health Awareness Month. And I would hope that you have khutbahs curated for each of these times of the year, right? Domestic violence, I hope that's kind of talked about in the month that it's for, or whenever, but just sometime in the year, these topics rotate and they actually surface. Because then you as an imam, what ends up happening is the people in their mind go, well, Imam so-and-so can't be so bad. He mentioned it in his khutbah. He must be safe enough for me to go talk to. And then inshallah, you're trained to figure out where to send and to refer to beyond you if you need, that person needs professional care. Does that make sense? I hope, inshallah.
Again, thank you, Jazakumullah khairan, for bringing all these topics. And are you willing to share the PowerPoint, instead of we are taking pictures and some notes?
That I'll have to ask permission for, because I think this is something made by the Madison folks, not myself, and so I have to, this is why we gave the workbook, so you can take all the notes you want, mashallah.
You have some of the notes, it's not that easy to take it. But just one thing, to mention that where you mentioned that there is kind of stigma with people not seeking help. I found the opposite, especially when you move to other city where majority are not the first generation, it's Muslims, second and third. And actually, when we announced that there is a Islamic counseling service done by Imam, in 24 hours, we have 19 sessions being booked. And 50 of those is related to the mental health. So it's people seeking help, and maybe there's not much resources for them. I'm talking about Canada. Maybe I'm not sure here, like in the States, But here, my 2 points, regarding the suicide, I differentiate kind of between those they have a thought that comes and goes not that often. And I will try say, most of the time I deal with that myself. But if somebody has like a attempt, or somebody has a kind of a plan, where certain plan to do something, that's the one I refer to. So I'm not sure about this, way of practice. If just a person that has a thought once in a while, about this because of he felt down in one situation. I feel if I refer that to the specialist, then it might that actually psychology, like in affecting that person, put him in that mood, or actually not gonna get the right advice. That's one thought. I need your comment about it. The second thing, in many cases, I look at the suicidal thought as symptoms, not as a problem. So we try to find the reasons of that, and I don't know if you'd like to share that with you or not. There are many of those cases. I dealt with it, and there's a way for me. Maybe we can talk about that later. To diagnose, not with just make assumption that could be qareen or sihr or whatever, because from my experience, this is one of the symptoms for tahakkum al-qareen. The qareen has a kind of control, and there is a set of symptoms beside that one and signs, and we can discuss that and talk about it to confirm for me this. And many cases of those, alhamdulillah, after a couple sessions of ruqyah, all of those thoughts disappeared. And I'm talking about cases now I've seen 10 years ago, and not none of them, have like any of those symptoms. So I'm just saying, sometimes, of those cases, I look at them as a suicidal thoughts, not as a problem, but as a symptom for something.
Sure. I had mentioned earlier that this, and inshallah, in time, it will take us a little bit of time to do this, but we have created, inshallah, this and spent a few years working on how do you figure out at what point are they actually symptoms, right? As in to say, how do I know that what the person who is suicidal in front of me, that this truly is a spiritual crisis that they're going through versus a biological issue, right? And sometimes it's really hard to sort that out right immediately. So I'll speak to the second question first, which is that is there any issue necessarily, at least from my perspective, I'm speaking personally here, from my perspective of having a person go through ruqya in addition to seeking out the psychiatric treatment of help? Absolutely not. It's perfect. I mean, that's exactly what we want them to do, because it's the sunnah of the Prophet ﷺ, whether they're going to read on themselves or go to somebody else. But the point being is they're bringing in a spiritual protection along with, if there is a mental health issue, that's on the psychiatrist to figure out. That's not your responsibility, because not your training. But your training may be spiritual counseling and be able to pastoral spiritual counseling, and to be able to say, let me help you with the ruqya part, or whatever spiritual advice and help you're giving them. But in terms of, is this also potentially a psychiatric issue as well? That's on the psychiatrist, right, or the psychologist. And so I think that's kind of an important delineation, inshallah. But we would hope people do multiple, because you're made up of, right, the bio, psychosocial, spiritual, right? You're made up of all of these aspects. So all of them need to be taken into consideration, inshallah. We are running a little bit low on time for this particular module, and so I'm going to just end here with your excuse, inshallah, because we're going to come back in the afternoon and have more space for discussion. I'm just going to, last thing that I'll close with this before handing it to Dr. Ahmad, inshallah, is you asked me for the page. This is the page I'm referring to. It's on the Medicine website, and it's actually under this topic of Muslim community suicide response. It talks about the training that I was referring to, but it also has the khutbahs that I was also mentioning. This is the khutbah where you can just download them immediately if you want already written for you. That brings in all the aspects of the khutbah accurately by fiqh, and then also all the correct medical psychiatric knowledge related to this topic. And this, you'll find the prevention khutbah here and the postvention khutbah here as well. And then here you find the links of the articles that I was referring to, and also some of the links of some of our sister organizations that are also Muslim mental health organizations that you can access and benefit from too. These articles up here that are the khutbah guides, and then also the ones related to the do's and don'ts. There's articles that we wrote on Muslim Matters on, 10 things to do in your community, 5 things to do, kaza, like on and so on, that are directly downloadable for you. And this is the manual, which is not yet downloadable, but it is, inshallah. Hopefully we have another review iteration of it happening right now. But one day it'll be ready for you to have the full, if you really wanted the full 100 pages, you're welcome to it. And then the training. So this is the page that I was referring to with all the resources. I hope, inshallah, that could be of use to you. In the afternoon, I'll probably show you this page again, but it'll be on the resources tab, because on that tab is where we have a lot of the directories of Muslim mental health professionals nationally, and in Canada too, for that matter, kind of North America. This is, here, I'll show you. This is, it's madistan.org. So madistan.org, O-R-G. And then from there you can get to the different tabs. We don't directly. So the question was, do we have any of the material translated into Arabic? And the answer is not from this material directly, but there are some mental health websites that do have Arabic translated mental health resources. So I can try to get that for you and give it to you, inshallah ta'ala. Good, excellent. With that, inshallah, I'm going to pause here and let Dr. Ahmad take over for the next module, inshallah. Barakallah fikum, thank you. I appreciate your attention and also kind of, sitting with this, which is kind of a heavier talk. The next section is on the pathological, kind of the understanding of different mental illnesses and what to do about them. And then your question from before about, Dr. Ahmad, about like if we can incorporate how to refer with each illness, who to refer to get support. Once you come back, inshallah, after this, it'll be lunch and dhuhr. And then when we come back together, the afternoon has sections on it that are how to build a more cohesive and mental health friendly, if you will, community in your masjid. How best to take care of your own selves, some parts related to kind of, I know when people hear self-care, they hear selfish. It's not selfish, it's actually directly from the sunnah of the Prophet ﷺ, which I hope to go through, bi'idhnillah, and also kind of practical implementations for your community directly, inshallah. Barakallahu fikum. I'm just going to excuse myself, I have another talk to give, but I will be right back after that, inshallah. Thank you.
Maybe if anyone want to stand up and just stretch, we'll go, Well, then we only have, we're done at 12. So if you can, if you want to take a break, but then we'll, Yeah, by 12. So they said we have to stop at 12, so you guys can check out, right? Huh? 12 and then 1:30. Yeah, because they said we're stopping at 12 so you guys can check out, because the checkout has to go up until 12:30. So you can start it, and then there's the dhuhr and there's lunch. So by the time we get back, it'll be 1:30. Bismillah. So again, I appreciate your patience, and I know it's tiring, but otherwise there's a lot of content that we have to get through, and so I'll be discussing common mental health conditions, and it's basically, it'll be, some of you have background already in mental health, which is great. Some of you, you're just learning some of these concepts and these terminologies. So it may be different relevance to each of you. This idea is going to be kind of like, a normal college abnormal psychology class that we're just going to condense it into this PowerPoint, just to give some highlights of what are the major mental health problems. And I'm also crediting my wife, Dr. Sosan Ahmed. She's a clinical psychologist as well. She's teaching at Cal State Fullerton. So I just took a lot of her slides. So if I'm gonna use them, I need to credit as well. So what is abnormal psychology? Here we're talking about how do we categorize these things? Behavior, how do we predict and explain someone's behavior? And one of the questions that you all, maybe we can ask is, do you need a diagnosis? Do you even need the diagnosis? We're talking a lot about, is it this diagnosis or this or this? Do you need a title for your condition? In America, we only really need it because of insurance. The insurance will reimburse you based on your diagnosis. I don't know why this thing, is it just going on its own? So, I was living in Qatar for 6 years, and I was directing the psychology program at the largest children and women's hospital, Sidra Hospital in Qatar, and there it's socialized medicine. Everybody is covered, so you don't have to have a diagnosis to get services. So I wasn't as concerned about how am I going to label this person's diagnosis. Do they have this or that? It's more like, what are their features? What are their symptoms? What are they struggling? And then can we give them advice and some feedback to help them and the family? That was more important than whether or not they had a label. And because we were in Qatar, we didn't need to enter a specific diagnosis. We could have said something very vague, developmental psychological problem, or some kind of, depressive or anxiety symptoms, and don't leave it like that. And some families, they didn't want any diagnosis anyways. And there's the stigma of mental health, but there's a stigma of having a label too. And some of the families were like, they were worried if their son has a diagnosis, then they won't be able to go to, Khidmat al-Wataniya. They couldn't get qualified to go into the army or get a job because they're worried about this. Although we had a really good HIPAA compliant records that were very sealed, like nobody would know your medical records. But the only time I would have a diagnosis, for example, a child, I look through it, we do an examination, we do evaluation, realize the child has autism, high functioning autism. tell to the family, do you need the diagnosis? Or would you rather just have some recommendations and we'll give you some strategies and you might need to have some type of therapy, ABA therapy or something? The only time we would write up a diagnosis and report is when the family, maybe they have to move back to Canada or America or UK, and in order to get services, they need to have a diagnosis. So this idea of like labeling everything is something we can be flexible, you know, in our communities. It's only if you really need it for some purpose, insurance, or if you need services. Like if you're an autism child, you do need to have a diagnosis so you can get the school district to give the services to the child. Just a disclaimer, when you're learning abnormal psychology, what happens is you start diagnosing everyone around you. You'd be like, oh, that's my brother, and my sister-in-law is like this, and like, oh yeah, you start to think like, oh, that must be OCD, oh, that's probably depression, or, you know, all of these things. So just keep that in mind. We get caught up in like these, you know, when we start learning about so many different mental health struggles, we start to diagnose each other. It's a normal thing that happens, so I'm just warning. So what is abnormal? How do you know when someone is doing something outside of the norm? It's pretty, you know, just think about these questions to yourself. It's pretty normal to have anxiety as you're preparing for an exam. Pretty, you know, you might cry if you've heard bad news. You might feel like your personality keeps changing in certain situations. Are you crazy if you're in an anger state? You know, these are questions that we have to kind of like figure out, you know. When we look at it from a clinician, we are looking at typically the 4 Ds. Deviance. I think you have the access to this if you want. We'll send out, I don't mind, we'll just send the PDF of all these slides to you, so you don't have to, you know. So how do I know if it's abnormal? Is it deviant? Is it so strange and unusual, out of the norm? You know, statistically, just doesn't seem right. Is it distress? You know, some people have a strange behavior, but they're not stressed about it. You know, they have, okay, you're kind of an odd guy, you're kind of unusual, but it's okay. You don't seem to be stressed. Okay. Dysfunction. Maybe you're doing something, but it's actually impairing your life, your day-to-day life. You can't go to work, you can't sleep, you can't take care of your responsibilities. This is like another part that we're looking at it, whether or not it's abnormal. And then lastly, is it dangerous? You know, if you're doing something that's, you know, risky, then again, it may go into the abnormal way of how we categorize things. There's definitely limitations on this. You know, there are ways that we can't always fit everything using the 4 Ds. So, you know, I acknowledge that this is just meant, you know, as a clinician, we're just trying to get some focus so we can better identify what's wrong with the patient so that we can then give recommendations. What is abnormality, you know, comes from the society, you know. So in the Padong tribe in Burma, there's a tribe where the women will put these rings on their necks to make it longer. And it's considered socially a type of beauty, it's the norm. And okay, it must be in their culture. But if someone were to do it from a different culture and start to stretch their body and do things, and they don't have any social norm like that, then you might wonder, is this abnormal? Because you don't have any other influence from it. The culture, the context definitely influences what we call abnormal. And this is the problem for Muslims, is that in the West, they keep changing abnormally. You know, what is abnormal? Every 10 years, they change what is abnormal. So even the DSM has problems. You know, it reflects the culture that it comes from. So back in the 1940s, homosexuality was in the DSM. It was one of the diagnoses of a disorder. Then later, as their society changed, they said, well, it's not abnormal anymore. They took it out. You know, so we have to keep that into mind as well, that a lot of these diagnoses of what is abnormal is influenced by the culture. So it's very elusive at times. It's hard to always define it. That's why for me, I said my first question is, do you need the diagnosis? Because it's so strange, and sometimes it's very challenging to have a label and find it. Do you really need it first? If you need it, okay. But if you don't, you know, you have to think about that. We're not going to focus too much on treatment right now. I'll mention it here and there, but we just don't have the time to give all of the types of therapies and how do you intervene in different types of diseases. Right now, the focus is just to give you an overview of the features. What are the symptoms that we're looking at? I don't know why this thing, it's on a timer, yeah. That's good, maybe it keeps me going. But you know, you seek help. The trainer, the healer should be trained. This is a problem that we have in the Muslim world, is that people just, you know, say, yeah, I'm a therapist, and they're not trained, they don't have a license or anything, and it can be very dangerous, especially if the person is just, you know, giving their own opinion. And you know, when I first got in Qatar 6 years ago, they had no laws of licensure. So you could just have a bachelor's in psychology and call yourself a psychologist. No country could you do that. So then we helped them with the Ministry of Health to define the licensure, so they understand, like, you need to at least have a master's degree, you need to have some kind of theory and practice that's already been established in your career so you can get the license. About 30% of adults and 19% of children will qualify for a mental health diagnosis every year. And there's different views on how does this happen, like why is this happening? Not everybody, you know, not everybody is diagnosed at that moment, but there's a certain percentage every year. And some of the views are that it comes from a physical cause, and others say it's from a psychological cause. And the short summary of this is that it's basically an ongoing discussion about, you know, the nature, the nurture, social influence, cultural influence of what, you know, how do we get these perspectives? Then, you know, things have changed in this century in terms of the severe disturbed patients, because we have now discovery of the psychotropic medication. And previously, there was this whole thing about you were institutionalized. So many patients were just in these state hospitals. And if, you know, you guys, there's like, you know, the movies of this, like, you know, from the 60s and 70s, like that's how we were treating mental health patients. Just put them into a state hospital and they'd be in this sort of crazy farm, and that's it. They live the rest of their time. With time, we deinstitutionalize these patients. We got them out of them, and now you get more what we call outpatient care. Things where you have clinics in the community or in a hospital or in a clinic, a community clinic. So over the years, there was a big decline in the institutionalized, mental health patients and how they had to then be distributed out. So if you're less severe, you could just be fine with outpatient care, meaning you go see a clinician, you go see a therapist, at their office, at the clinic, and then you go home and you're fine and you do your, weekly life like that. You can have a community mental health approach where people will go in a very, personable way to interact with the community, to seek mental health services. It's a little bit, accessible. And then you can also focus on prevention. This is another way that we've sort of changed with mental health over the years. We're looking at what are the social conditions? What does it mean to be at risk? Some people are more at risk than others. And we should focus maybe then on the ones who are at risk. Not everybody who goes through poverty ends up with PTSD. Not everybody that experiences war even, they don't all become PTSD. It's a certain percentage who are more vulnerable to becoming traumatized PTSD. So if you look at people who come from very poor and dangerous experiences as a child, it's not that whole entire neighborhood is now all traumatized. It's a certain percentage that develop these disorders. Then we have looked now at the multicultural psychology now is getting bigger as well, especially like in APA, the American Psychological Association. They've now started to incorporate a lot of other cultural ways in which it's more appropriate for people as opposed to, the way it was maybe thought from just Western white American kind of viewpoints. And then mental health parity. That means that like your insurance can cover, therapy, mental health intervention. It didn't used to cover before. I'm not going to go into all of the details of these, but these are some of the dominant theories of why people have pathology psychologically. The summary is just to say that there's so many viewpoints on how you can reach a certain disease, and sometimes multiple ways that it can happen. So the biological model, it's very much like something is wrong inside you, something in your brain, something in the brain chemistry, your neurotransmitters, something's off. And they have a lot of studies where they can image this and notice what's happening in the brain. We know just statistically, a child who's autistic has a larger frontal cortex, just the number of, they have more neurons packed together in a spot than the average person. So there is a biological underpinning for many of these conditions. The cognitive behavioral model, it basically goes to your thinking style. How do you look at the world? And that may be causing you, psychological distress. So how how do you look at tragedy in your life? If something difficult happens to you, do you see this as something that's punishment to you? Do you feel you are somehow the only one? Your cognitive lens will sort of inform how you react to things. And I think this is very prophetic when we think about as Muslims that like a lot of what we do is restructuring the way that you think about the world. That's how I feel like from, you know, our mashayikh and our scholars over the centuries, is that we're helping people understand that like there's a larger picture, and you can find ways to look at things, even difficult things, tragedies, and find a way in your mind to make it, oh, okay, I can understand it, and then you feel not as anxious or stressed because of it. The social view is that, you know, again, the cultural attitudes, the beliefs, the history of your people, all of this can, you know, go from generation to generation. There is a concept that if a certain people have been oppressed so long for that, the whole generation, the next generation of kids, they inherit some of that parents simply because they're, you know, they're raised in the same stresses as their parents, and it becomes a generational trauma that goes from one to the next. So there's so many models about how, you know, how do we look at abnormal conditions, and what causes the dysfunction? You know, some of these perspectives have more evidence than others. Some of them, your therapist has a different role depending on the model that we're looking at. And the goal may be slightly different depending, again, on the model that you're talking about, the therapy goal. So I'm just going to give you guys an overview of what does the clinician do when they're, you know, facing a clinical intake. The person comes into my clinic. What do I do? How do I figure out, you know, what's wrong with this person? So we collect a lot of information. You know, it's very rare that someone walks into your clinic and you realize, okay, I know right away with the diagnosis. No, usually you have to gather a lot of information. Historically, currently, I want to interview the patient, but I also want to maybe interview the family. If it's a child, I might want to know the teacher's perspective. What do they see? The more information, the better, because you'll be more accurate. Then we will also have tests. In clinical psychology, we focus a lot on tests to make sure that, is this behavior standardized? Is it normal? You know, is it out of the norm? And then the clinical observations. So just watching the patient, what do they do? Sometimes if it's, again, a child, we can look at them in the school setting. Is it different in the home? Is it different if they're going to, you know, their sports, you know, and just getting a sense of their behavior and their sort of mental state. That's something that the clinician has to observe. So you can't just use one tool. The point is you have many tools to combine all this information to get your assessment of the patient. For the clinical tests, in psychology, we have, you could say, like, it's usually around 6 categories. The projective tests is when it's, you know, like if you guys have seen the Rorschach or these kind of images that look kind of vague. And the purpose of that is then the patient can then, you know, respond to something vague, and it gives us a sense of, okay, how do you normally look at the world? If I give you something very vague, then it means you have to put your own conclusion onto it. We have personality inventories. We basically have questions that we ask, and we can figure out just with yes or no questions if you're more likely to be depressed or more likely to be aggressive, these kind of things. We have response inventories. That's a little bit more obvious. Like you could have a clinician rated or a self-reported questionnaire. Like there's something called the Beck Depression Inventory. Maybe you've heard about this. It's just, you know, it's like a page of questions, and the patient just rates from 1 to 5 or 1 to 4, and they have to like rate it, and then we can just add up the numbers and we get a number, and we realize a certain clinical cutoff usually means you might be depressed. If not, so we just use that as another tool. Again, you don't diagnose someone based on one questionnaire that they filled out. That would not be ethical. But we use it as part of our assessment. Then we do some labs and some clinics. They'll do these psychophysiological tests. They're like, you can look at the skin tense. You can look at their EEGs and their breathing and their blood pressure and these kind of things. Then you do a lot of brain-related type tests. If the clinician is wondering, is there something going on in the brain? Do we have neuroimaging done? Is there an MRI? Neuropsychological testing? Does the patient have like an attention problem? And they're not getting the information into them, and that's causing them problems in life. And then we have cognitive and intelligence tests. So sometimes your life struggles might be related to your level of intellect, and you're being faced, we have many young children, they're being, stressed out because they're supposed to have certain grades and academics, and they may not have the cognitive ability to do that, and it's unfair to put that pressure on the child. And then if you do that pressure, they have other psychological problems. So we need to look at sometimes just the intellectual ability of the patient. Similarly, there are some psychological changes that happen after brain injury, stroke, early stages of dementia. You'll find more depression or anxiety as well. So the question is there a clinical tool for emotional intelligence? There are some similar. It would be partly in the personality inventories and some of the response inventories, but there are questionnaires where you look more at the person's emotional intelligence. But it's also, it is a little bit of a label that's used in pop psychology. So the clinicians, we don't really use it as much. You see it more like in the internet or on YouTube of people talking about emotional intelligence. It's not that it is a real thing, but we don't emphasize it to that level that you see it on social media. Yeah. Yes, so great question. I'll summarize the question is basically about there's a whole other field of psychology. It's called industrial organizational psychology. And it works as it's psychology about the workplace and how do people perform, and can they do negotiations and have deals and these things. And that's a real field, but it's not what we could say the clinical side. It's not necessarily related to psychopathology. It's more about helping you be more efficient. Can you function in your business responsibilities? How can you get the company to be more productive and make more money? It's a very, when I was in grad school, and I'm doing the clinical psychology PhD, and then I noticed my friends in IO, International Industrial Organizational Psychology, man, they were getting like totally different job offers, and it's a totally different, it's a corporate reality there. So it's different than the clinician, where we're a little bit more in the individual functioning of your life, but there is overlap, and sometimes we both will borrow each other's tools at times. The clinical observation is very key, because there are people will come to the community and they'll come and say, okay, doctor, I think my loved one has depression, and they have some explanation, they have some history, they give me some examples of their life and what's going on. I was like, okay, great, but I still need to see the patient. I need to see that person. How do they interact? What is their behavioral observation? Because that's very good. I need the background information, but I need to know their naturalistic observation, because it could be very situational. It may be the family member themselves who's giving me that. They're actually the one who's causing most of the problems in that person, because it's the two of them together that they're having the problem. But if you just pull the person out and have a third person observe, you realize, oh, you're fine. It's something about your family interaction or some other conflict that's happening. So we look at it, naturalistically. And then we'll also sometimes ask people to do self-monitoring. So, the muhasaba is a real thing, for you to self-monitor yourself. You can even I'll ask patients, just have a checklist this week. How many times did you have a panic attack? How many times did you break down and you felt like you couldn't breathe? Just check it off, and we'll make a chart. And next week when you come, we'll look at it, and we'll monitor it every week. And sometimes what helps is you realize they only had like 2 or 3 episodes. They were telling me they have daily episodes, multiple, and then when they actually track it, they realize it's not as bad as they thought. And sometimes just simply giving them the recommendation of self-monitor, that itself is therapeutic. And 2 weeks later, the patient doesn't have any complaints anymore. They realize, okay, maybe I was overthinking. Maybe it's my own I was tense, I was anxious, and that was, Exactly. Yeah, so great point is that if you track it and do a lot of self-monitoring, you realize it's certain situations when you're stressed out. It's certain people that you're with, and then you get this anxiety attack and panic. You realize, oh, when I track it, it's related to something. Yeah, that's a great question. So the question is about when people report and they say there's a certain person or a type of person that's triggering me. Is that your question? And it's really the larger environment that the person is in. And also, we, as a psychologist, we're not your friend, We're gonna give you some pointed observations and say and some questions, some hard questions about, that's strange. So really, it's only that, other people are doing it to you and you don't have any role in this, We don't do this on the first session, The first few sessions, you're just trying to build rapport. You want the person to trust me and I trust them. But eventually, at some point, we're not there to be your coach or your best friend. We're here to highlight the consistency in your thinking and your feeling and your behavior, and helping you realize, oh, I'm blaming everyone else, except maybe I have some things I could do as well, to play a role. So the DSM, the other major categorizing text is called the ICD. It's on the 11th version now. The ICD is more international. You'll find it outside of the US more commonly. It's just another way to categorize things. And again, it depends on whether you really need that diagnosis. And they look at clusters of symptoms. If you have certain clusters all together, then that gives me a sense that, these are disorders. There are some problems with diagnosis, which is you can have misdiagnosis. If you go everything just textually, and you're just looking at it, okay, you got this, okay, great, you must be a neighbor, but there may be some of gray areas where you could have put them in a different category, or maybe no category, and so we have to have, sometimes there are people, so many people have been come to my clinic and they're told me that they've been diagnosed with ADHD. And I do a full assessment, and there's no way this person has ADHD because they attended with everything with me. And the true ADHD person cannot focus on anything, even the things they love, But if the person is sitting there and they'll be really engaged with something they like, then it's not a disorder of the attention. Your attention is fine. Maybe you have something else that's, distracting you. So that if you don't have the right diagnosis, unfortunately, that means then you might have other recommendations that are not applicable to you. And the worst is if someone who gets medication and they don't need that medication. And unfortunately, there is a lot of overdiagnosing. People just get, now it doesn't even have to even be your psychiatrist. It could just be your general physician who decided, yeah, you need anxiety medicine or you need depression medicine. All right. What I'm going to do is I'm going to kind of go through a very quick, overview. I'll skip some slides because we don't have time. But then we will, if there's something that we want to focus more, specifically after lunch, we'll return to it. And we can go in it with more depth. So if that's okay, I want to keep, be cognizant of your guys' time. 5 minutes to 12, right? Yeah. So yeah, we'll try to go like the next 5-7 minutes. And in that 7 minutes, you're gonna know all the diagnoses. So anxiety. The reason I'm starting with anxiety, it's the most common, and it's in the Muslim communities as much as it is in the non-Muslim. It's not like Muslims have different mental health problems we do have some specific manifestations of it, but it's still it's the same as diabetes. Muslims with diabetes, they look similar to non-Muslims, with diabetes. It's just, Anxiety, yeah. So fear, anxiety, fear is related to anxiety. Fear is you're worried about a threat. Something is threatening me, so I have a response in my heart, in my soul, and in my body. Anxiety is when you have this vague sense of danger. You can't really pinpoint it, but you have all the alarm, signs that I should be fearful right now. I don't know why, but I'm feeling that fear. So it's much more like I can't specifically figure out how it's happening. That's the anxiety. If you're in a fear state, if a bear walks in, your heart rate will jump and you're going to have tense. That fear will be the same exact as anxiety. The problem is with anxiety, there's nothing came in. It's just like around you. It's your environment. It's how you experienced the world. Yeah, sure. So the question is about hormonal changes, the adrenaline, there's cortisol in the body as well. It's a stress response. So basically, in all those, there's things that are going cognitively in your mind. You have a lot of fears and you're assessing threat. There's also things in your body that are happening. sometimes without your awareness. And so the corticosteroids are activating in your body. It's meant to prepare your body in case you're about to be attacked or something. But too much of these stress hormones will eventually hurt your own body. And you'll have a lot of people with anxiety will have physical symptoms. Shortness of breath, heart rate is irregular. A lot of people have digestive problems because of anxiety. So if someone is coming to you and they have all these complaints, and you're thinking, do you have something wrong, physically with your body systems? But it actually turns out it's part of their anxiety disorder. So the question is, which triggers? Is it going from the physical to the psychology or back? I would say both. It can go both ways, and it also will relate to your own family history, your genetics, things that have happened in your young childhood that happened to later. So all of these things will be factors that will go into it. Confusion and anxiety, are those the same? No, they're not. So it's not the same. Although you may have confusion of why you're feeling this way, but you can be confused and still be calm. You can just be like, what's happening? Where am I? But you're very calm. Or you can be tense and reacting to everything, overreacting because of that confusion. So that they can come together, but they don't have to be this. They can be separate as well. They're not the same exact thing. Question? Who was it? So normally, if you learn about the reason of why you're feeling this way, usually you feel better. So, for example, we have a lot of people who, I assessed a woman like in Qatar. She was wondering why she's having these panic feelings, and she's having difficulties in school, and she's brilliant. We tested her intellect was fine. But when we realized she had a very specific type of deficit, it's called executive functioning. Her now I understand why I'm doing this, So usually it helps you feel better. Unless you're already just an overthinking person, and literally any new information you get more anxiety. Wanted to get a sense of so we have, as you know, we only went through half through my slides. We just kind of touched on the anxiety disorders. And then if you wanted to, we could go into the different kinds of anxiety disorders, and then some of the depressive presentations as well, what those symptoms look like, and how do we diagnose that. But we have also a discussion on how we can create a supportive environment in your communities, in your masjid, to make sure that individuals with mental health issues feel welcome. So that's one of our topics. There's Dr. RANIA has the importance of self-care for the Imams as well. And then we will also have a little bit of discussion on how to collaborate with mental health professions. You know, when you're ready to make a refer, or when you know, understand the landscape of how you can access the professionals, the clinicians, you know, in terms of your own work that you do in the masjid or with your community. So, does anyone have like a preference on that? Like, should we continue with the disorders, or should we go forward to these other topics? If you have like a self-care, okay. Yeah. Right. Right. Yeah, so one of the reasons of just knowing the disorder is when you make your referral, you'll have the terminology of like, to tell the clinician, these are the symptoms. Yeah. So, yeah. Yeah. Yeah, so maybe let's just, yeah, we can quickly complete the slides that I was going through. I'll skip a lot of them just for the interest of the time. And then let's just do like, you know, maybe 15 minutes, and then, and I will ask, you know, Brother Sadiq to, you know, to just share my slides with you guys, like, you know, as a PDF. You can take all of them for your own, you know, reading. Huh? He let me email it to all of you. Okay, good. All right. Okay, so we just kind of, you know, quickly will go through the general anxiety disorder. Is it's very general. It's kind of you're just worrying, overthinking about general topics. It's not as specific as like a phobia. And it reduces the quality of life. And what we're generally looking for is, again, the idea of the disruption in your life. You know, you may consider yourself a worrier, and you get worried a lot, but you're not impaired in your day-to-day life. And so then we probably wouldn't consider that as like a disorder. It becomes a disorder, as I mentioned, if it gets to the level where, you know, you can't function. And so some of the symptoms are you're edgy, you're fatigued, you have poor concentration, irritability, muscle tension, sleep problems. And so these are thought, if it's happening more than 6 months in duration, then it's something that needs to be looked for as possible a general anxiety disorder. The phobias, again, it's very specific type of fear, and people will go to great lengths to avoid whatever it is they're fearing. So if you have a fear of being in an airplane, then you'll do everything just on land, you know, to avoid that situation. And for some people, you can have a phobia and your whole life, it doesn't really affect you because you just avoid it. If it's a certain thing, if you have phobia of a dog, you just avoid being near dogs. But the problem is if there's situations around you where it actually impairs your life again. I'll just skip that. And agoraphobia, again, is about avoiding crowded places. And generally, it's people that it develops in their 20s and 30s when they have to kind of be on their own and be independent and then interact with the larger, you know, society. Social anxiety disorder is when you just have this irrational fear about, you know, being judged. You think your performance is always lacking. You feel like there's something wrong about you. There's something that you're a failure in some way. So you tend to just judge yourself as you're just not competent. And so we all have times when we feel, you know, unsure, we're a little bit shy, or we're not really confident. That's okay. But this is when it becomes so persistent and irrational. There is this this term now called nomophobia, which is like no mobile phone access, where people have a fear that they lost their phone. And where did I pack my phone? And I think this is related to also just communications, you know, social media. It's a big problem now in that type of anxiety, particularly in adolescence, where people just feel like they're missing out on something. They don't know what it is, but they have a fear that they're missing out on something. And then panic disorder is the more very somatic manifestation of this type of anxiety, where you have an actual physical panic attack. You might have shortness of breath. You might experience your heart rate increasing. You might have, you know, just a loss of focus, concentration, ability to attend to things. And then you just feel like sometimes when you're in a panic state, you feel like you're choking, or you might about to die. So this can also then build upon another fear, the social anxiety, which is you don't want to go outside because you might have a panic attack, and then it's very embarrassing. So it's like it becomes compounded sometimes, some of these fears. It's you know, it's still, in terms of statistics, it's not the most prevalent, you know, it's lifetime, you know, 5% of people. And it's more common in women than males in panic disorder. And as I mentioned, it can co-occur with other forms of phobias. OCD, obsessive compulsive disorder, I think it's a well-known condition, and particularly it basically contains obsessions and compulsions. Obsessions are when you have these persistent thoughts, a certain idea, an image in your mind, you just can't get it out. That's an obsession. Compulsion is a behavior. You're doing something repetitively, usually to soothe the anxiety of the obsession. So it becomes very excessive, unreasonable, and causes a lot of distress. You can have, by the way, compulsive behavior that's normative and sometimes helpful. You know, butting your shirts in order. You know, most people do that. We do it obsessively. We don't go randomly. We do it because it does give us a sense of, comfort and structure in our life. There's certain things that people do that, it's just a compulsion. They feel like it's better to do. And most of the time, it doesn't disrupt your life. But the OCD, clinically type of significantly, symptoms are the ones that are very intrusive, and you can't seem to resist it. So common themes are like you're worried about, you have these obsessive thoughts about dirt, and so you want to be clean, and so you do these compulsive behaviors. For Muslims, I think the most common thing that happens that you might, as a spiritual leader, you might face is issues of tahara. So we get a lot of people in the community that have obsessive thoughts about, did I get my wudu? Was it correct? Did I cover the water in the right spot? And maybe I should restart my wudu again. And then they'll go again, and the third time and fourth time. And it can be very disruptive to the person's life. It takes them 20, 30 minutes just to do one wudu. So it's a more specific, form that you see in the Muslims, but it's part of the same idea, where you have these obsessives thoughts, and you need to feel like a compulsion to soothe yourself out of that. Yeah. Yeah. Yeah, subhanAllah. Yeah, the waswasa is strong. It's very strong. And there's whole abwaab and tahara just for the salas al-bol, and how that's why they do extra water in the shatafa, simply to counter some of these ghastly things. Yeah. Yeah, extra water, yeah. Yeah. These anxious thoughts are, part of it, it's a good intention, right? I want to really comply with my deen, so it's a noble idea, intention, but the application is not getting you to your goal. You're missing your salah because of it, so part of I think the intervention is just helping the person think about the larger goal of what you're doing. And then you have to show them all the different dispensations and a lot of the flexibility that's actually in fiqh, but people assume because they learned fiqh in a very rigid way, in a very limited way, they didn't know that there's a lot of, ways to kind of address this. Usually learning your deen properly helps you, makes it easier. Yeah. So the intervention, in obsessive, behaviors and compulsions is that you, extinguish that behavior, and so you kind of, do these exposures where the person can realize that it's okay, you can go through it and learn ways to basically cope until you become functional. Yeah. I'll skip just for time. Obsessive compulsive is it's a large topic, and it relates to even some of these other behaviors like hoarding, people that pull their hair or their skin. It's all part of obsession. Even people when they have these body dysmorphic thoughts about themselves, they're obsessive about themselves or some image about them, and they can't get that obsessive thought out. So when we look at it from a developmental perspective, I liked this kind of diagram, just because it gives you a sense of like what happens when you have, anxiety just runs in your family. There's a genetic factor. And, you can have two babies that have quote unquote unfavorable genetics. So they're vulnerable right from the beginning. They have some risk factors. But then that's where the environment can support. So if you had, you start out, you're very inhibited, you don't explore, you're very anxious, but then you had a parent who allowed you to experience a little bit of anxiety, in a controlled way, go into a small adventure or something where you feel I can be brave, as opposed to an overprotective parent who doesn't expose you to anything because they know that you're anxious, and so then you never get those experiences in life, and then finally you grow up and you're on your own, and now your parents have completely protected you all these years. You've never been challenged in that way. And then you can have negative self-talk where you start to tell yourself, I'm going to fail, I can't do these things, as opposed to someone who's been learning how to talk and think more positively. And that's more like husn al-dhan. Husn al-dhan in general is a great intervention to anxiety about like, Allah has a plan. You don't have to be in control of everything. And that relief can be very helpful for people with anxiety to realize, yeah, of course, I'm not in control, Allah is in control. And so that's why you can have someone of the same genetics have two totally different outcomes at the end, simply because of these supports and a more intentional way to grow up. Let me just say about PTSD, the psychological stress when you have, something in, some kind of injury, or you participate, or you witness something very traumatic. You can have, what will happen is people that have initially an acute stress disorder in the first few months, they're having these kind of panic feelings, the recurring memories of the event, they're having, they can't go near a place that reminds them of the place that they experienced something traumatic. So you can have a lot of these, just in general, what they call hypervigilant behavior. You're more like just worried about threats all the time. So any little sound that crashes, you think someone's attacking you, and it's really just the stress response that's been gone too far. And so acute stress disorder is usually in the first few months. If it continues, it could develop into PTSD, which is someone who's been 3-6 months and beyond still having these symptoms. And again, PTSD, the current prevalence is like 3.5 to 6%. Lifetime, 7 to 12%. So some people in their whole life, they might experience it, about 12%. But which again, which is very interesting though, is just the resilience of humans. Which is, if you go, as I said, in a very traumatic situation, it's not like all the people get PTSD. It's a certain percentage. Likely related to some of their risk factors, biological factors, their early childhood experiences, how they cope, their cognitive coping styles, their social support, and the severity of what happened to them. Like a major natural disaster is different than like, tripping or falling into a pool or something, which still can be traumatic for a kid. In similar idea, you can have, again, certain risk factors, and then the external environment can shape it in a more healthy way or an unhealthy way. And then the depressive and bipolar disorders, again, we're not going to be able to go through all of this, but the basic idea is that you have, you know, a low state, a low sad state, lack of energy, low self-worth. You feel guilty all the time. You feel like you've messed up or you did something wrong, and they're persistent. You can't, you know, shake them. And so it's pretty common as well. About 20% of all adults experience some depression at some point in their life. And there's various types of symptoms. You can have just, you know, emotional symptoms, meaning you just feel very empty, you feel humiliated. There's anger sometimes in depression. It's mixed with anxiety sometimes, agitation. There's a term that might be useful for you guys. It's called dysthymic. Dysthymic. If you notice someone, they're sad, they're kind of low, but they're not at the floor of depression yet. They're dysthymic. They're just kind of in this mood where they don't ever seem to be happy, but they're not super depressed either. You can have symptoms. The motivational symptoms are things like you have no initiative. You don't have any motivation to wake up in the morning, to go do your responsibilities. You just don't seem to have it. And that's a red flag if you just have no motivation. Sometimes we look at the patient about, you know, even their own hygiene. How do they keep themselves? Their grooming, their clothing. They just don't care at all. And if they have no motivation, that's a red flag for, you know, a more risk for, you know, self-harm or suicidal thoughts. Because at that point you feel like there's no, you know, helplessness and hopelessness are some of the most difficult symptoms that we want to always track about. You know, you can even just ask someone if you're worried about them, do you feel like there's any hope? That question can be very helpful just to give you a sense of how severe their case is. Behavioral symptoms are things like your actual activity has gone lower, like your ability, your energy, physically, you're slower, you speak slower, you just function slower. It can affect and manifest in depression in these behavioral symptoms. And then you can have cognitive symptoms, which is like you have these negative thoughts about yourself. You always think you're going to fail. Nobody has ever loved me. And this is the part where the therapist would come and challenge some of these things. Like, really, no one has ever shown you kindness? And then you know, ask them to list maybe examples in their life, and usually you can find out that they're specifically focusing on negative things in their life, and they're specifically ignoring positive things in their life. And that's another, you know, telltale sign. And then you can have other physical symptoms like headaches, indigestion, constipation, general pain in general. People can have actual physical pain with the depression. Sleep problems. We always ask about sleep patterns of patients. You know, are you sleeping too little, too much? So we have the major depressive disorder, and then there's other kinds of persistent kinds, and there's other forms of depression that might be related to a specific condition. So again, all of these slides will be shared with you, so you can look more specifically into some of the diagnostic criteria. And you can have depression that's more reactive. It's related to something outside of you, and something just happened to you. And you can have kinds of depression that are from within. Maybe there's something genetic, there's something hormonal inside of you that be, you know, causing you this. So yeah, the reactive depression is when you're faced with something that happened to you that was so sad that you are basically afflicted with the depression. Like the Prophet ﷺ, and he said when he lost Ibrahim, so like, oh Ibrahim, we'll shed tears, there'll be sadness, but we're not going to say anything that wouldn't, that would not please Allah. And that indeed with your departure, Ibrahim, we were afflicted with sadness. لَمَحْزُونُونَ. Not نحن حزينين, it's مفعول. It would happen to them. It just happens to you. Sometimes life does that, and you'll be facing something, and then you'll be afflicted. We mentioned there's cases, of course, of the postpartum, which can be very serious and sad. When I was in Qatar, we were in a large women's and children's hospital, and we did have a number of cases of women who suddenly got into these. Thankfully, if it can be identified early on, there's usually well-established ways to intervene. The problem is, unfortunately, there are cases we don't learn about them until it's too late. Okay, I think I'll stop here anyways, yeah. And we'll, continue, if there's something specific later, we can discuss further. Yeah. تفضل. Oh no, I mean that's a great question. I mean, I'll ask Dr. RANIA to comment on that. But in terms of yes, the neurobiological changes. We know that there's differences in neurotransmitters, and if there's an imbalance, there are ways where you could use maybe natural ways, and I know a lot of patients will come to them, they don't want medicine right away. They'll say it right away, I don't want medication. But depending on the severity of the symptoms, we sometimes have to refer to the psychiatrist, because I can't engage you in therapy if your symptoms are so intense that you're constantly feeling suicidal every moment. If we can lower the imbalance of your neurotransmitters through medication, then usually it becomes more useful to engage in therapy. And then at some point, usually the intention, and Dr. Rania can comment further, it's usually not that we want this person to be on medication forever. It's meant to then eventually titrate and then just continue with the therapy. تفضل.
Of mental flow everywhere we go, especially in our community. If we talk about mental flow, Dr. Ranish would like to mention every morning. So, how can we really try to get this thing out of mind? Because really we have
yeah.
all the time we get that people, if we think, this person is crazy, what is insane? Why is that? It's only a disease, but why a person never will just get authority opposing?
Yeah, you're right. I think I'll just show you something quickly. When we were establishing our mental health clinic in Qatar, and it's predominantly Muslim. We have 85% of our patients are all Muslim. Not all Qatari, but you know, other Arabs, Muslims from around the world, you know, and we established, you know, the clinic. Initially, we weren't sure if anyone would even come, you know. Would anyone even come, you know? And then every year we had more and more patients coming, Muslims, you know, conservative Muslims. And part of it is just the ability to open, which is happening now, more and more just open discussions in the community about mental health, and that there's actual interventions you can follow up with and improve your life. And so more and more families would come and just simply, we didn't do much, but just simply the referral, the word of mouth, it does have an effect. And so the more that you normalize it in the community, and more people will come, you know. And you're right, there are some, you know, families and people in our communities who will not even think that it's useful until they have a family member who's going through something, you know. And you know that you were in substance use, right? Nobody thinks addiction is a big thing until you have a family member who's having addiction problems. And suddenly the family wants to know, where do we go? What's the places? And this would have been a great conversation to have, you know, proactively before all this, you know, subhanAllah, but now we're in it. So, but now that I've noticed that just there's a ripple effect, and like every year more and more, you know, I think Muslims in general around the world are realizing, okay, it's about awareness than it is about, you know, the stigma. The stigma is there, but even with the stigma, people are going every year we were offering these services, they were getting more and more people activating and self-referring to the clinic. The stigma is hard because it's even in the Western society as well. I mean, we consider America, Western, as very progressive, but if you look at even just their questionnaires and when they do statistics and surveys, they have a lot of stigma too. It's not as high as the Eastern, you know, communities, but even in the Western communities, the issue of just seeking mental health services is there's always this issue about you're weak and you know, do you really need a therapist kind of thing. Although for the younger generations, it's changing. Yeah.
And you know that I get very excited when I start talking about the history of Muslims and mental health, so I'm going to spare you all because I get very excited about this topic. But our research actually is showing that, I'm not going to say that Muslims created or developed the first to develop talk therapy, but I will definitely tell you that they absolutely had a very big hand in making talk therapy become something that's actually very prominent within their treatment centers. And this is, you know, some of the work we're in on Al-Balkhi and Al-Razi and some of the others. It's very clear that not only did they conceptualize talk therapy as one of the treatments, but they utilized it and integrated it in Islamic kind of understandings. It's powerful. We don't have the time today. We talked about obsessive compulsive disorder. Some of you may know I was working on this with Abu Zayd al-Balkhi from the 9th century. And one of the most astounding things that he did is really not only understand and classify correctly OCD, a millennium before it is said that it was classified, but the therapy that he created for it is exceptional. It's exactly what we use today, this concept of an gradual exposure therapy, and which is a talk therapy. And it's very important to understand that they had no issue with this. You see it pop up in the different books and the different scholars that used it. So when we think of talk therapy, it's just like kalam, just haki, you know, like this kind of thing. It's not. It's a lot of tips, tools, and techniques of how to actually help a person get over the issue. The question of the salas was brought up earlier, just waswasa in general. There's some very excellent work, and I do a lot of work personally related to OCD and exposure therapy, and a lot of it with the Muslims is the hara-based or other forms of issues that are obsessive and compulsive. And it's powerful. If you can bring in the two parts. I'm going to give you a recommendation, inshallah. I was telling one of the brothers earlier, the Khalil Center has a wonderful workbook on an Islamic
method of working on OCD specifically. So you can look at their website and get that resource from them, inshallah. Yeah. All right. Inshallah, I think we're going to move forward. Do you have one more thing? Certain obsessive tendencies, or what kind of tendencies are we talking here? Not to my knowledge. Allahu alam. I don't know of a study like this. No. Allahu alam. Before I jump in, inshallah, there was a question earlier from one of the Imams asking, how do I know all the different things that Dr. Ahmad mentioned? How do I know who am I sending this to? Which type of mental health professional do I send this to? We actually wrote an article. It's on Muslim Matters, and it breaks it down for you. So it's there online, easily available. I'll put the slide back up, and I'm just showing you the website. And we kind of break it down. This is what a psychologist does. This is what a social worker does. This marriage family therapist does. This is what so on and so on. That way you have a sense of where to go. And then in the same article, we have a flow chart. If they say this, then do this. If they say this, then do that. If they say this, kind of like a flow chart. So you can follow along, inshallah ta'ala. So hopefully this is a helpful explanation. The website is called Muslim Matters. I'll go ahead and I'm going to share with you now Cultivating Mental Wellness. Thank you. It's called Cultivating Mental Wellness. Or if you were to just type my name into the Muslim Matters search box, it'll pop up. But this is essentially what we were trying to explain. Who prescribes medication, who doesn't? What do they do exactly in their sessions? How do you distinguish one person from another? What is this concept of spiritual or Islamic counseling versus Islamic psychology versus kind of regular counseling, and so on and so forth. So I hope this is useful to you, inshallah ta'ala. This is on the Muslim Matters website, which there probably is a link on Medistan as well. Yeah. Good? Inshallah. Excellent. Clarification? Yeah. Sure. Very nice, mashallah. And we'll come to that after this discussion on self-care, because we have a whole discussion on how do you work with mental health professionals, and then one on how do you make your masajid kind of more friendly towards this entire topic, inshallah. All right, so with that, inshallah, we'll go ahead and start this section. Bismillah ar-Rahman ar-Rahim, wa sallallahu ala Sayyidina Muhammad wa ala alihi wa sahbihi wa sallam ajma'in. This is a section that relates to self-care, specifically for Imams. It's very kind of custom tailored, specifically for all of you, mashallah. Hang on, I'm in the wrong place. I don't know why it took me in the wrong place, mashallah. All right, here we go. Bismillah. So first, a reflection. I usually like to start with a reflection to see how everyone is doing and what your thoughts are. So my question here for you is, when do you feel most burned out? And what are you doing more or less of when you're feeling burned out? Do we have a couple of answers? Bismillah. At the end of the week, okay. Fair enough. Petty issue. Right. So it also sounds like not only is it the everyday, it sounds like even the mundane, the everyday kind of stressors, the things that are family related in addition to the masjid, but also the perception people, your community, your congregation is holding of you to be perfect, and we're not perfect. Tamam. Yes. Tamam. Very nice. Yes. This discussion, because I think you're absolutely, everyone has mentioned things that will touch on things that we're going to talk about here, inshallah ta'ala. So first, I think this is the one you mentioned, which is the 24/7 mentality, which is basically that you can't really turn off the work of da'wah in your mind. So as you're doing this work, it's not just a 9 to 5 job, as you know, this is a 24/7 job, literally. And because you are the go-to person for so many in the community, I'm sure, and we get calls all the time. We get calls all the time in the middle of the night, a 2 o'clock in the morning call, help, there's some emergency. I'm sure you get something similar happen to you as well. And, if you are the sole person that the community turns to for spiritual support and help, and there are no backups, then you are constantly on, essentially. And that itself is not only not, is it not sustainable, but it's also not going to be something that's going to allow you to really be able to do this job long enough. I'm just trying to get it to connect, but hopefully it connects. In the Christian community, funny enough, or interestingly enough, I don't know, they asked me to come do a training for their priests and pastors. I thought this was so interesting, the hijabi woman standing in front of all their priests. It was really strange. Anyway, inshallah. But it was on the topic of burnout for the clergy. And the interesting thing about this, what's going on here? The interesting thing about all of this was that they had very similar concepts, exactly what you were saying. I mean, literally no different. This 24/7 mentality, constantly on, people calling or texting at all hours of the day and night. And there's no backup support. So for many, especially if they had a small congregation, they're the only person. There's no salary for any. You look at some of the more well-endowed communities, they have the assistant and the second assistant and the third. It's like a basketball team, like all the assistant coaches, But like if you are the only one, there's no one even to pass it to, not even a youth director or somebody else. Now the bigger masajid start to have more support potentially, but not everyone here is from a big masjid. So when you think about what that means for you, it's definitely kind of this 24-hour mentality, and you're just literally waiting for the next phone call or the next crisis to come. So you're never relaxed. Does that sound about right? Then there is this conflict, and this I think are the questions that you're bringing up, subhanAllah, related to, we know conflicts are going to happen. They're bound to happen because we're human, and the work you do is bridging and healing human beings. This is educating, healing, and working with humans. So there's always going to be conflict. So the issue isn't the conflict in and of itself, it's about how the conflict is handled. And when you get the criticisms and their ongoing criticism, you eventually wear down and you eventually can burn out. And this idea of like, even my husband always gives this thing every khutbah, every time. This last Jum'ah, he said, somebody came up to him and he said, he said, I have a, so interesting. I said, this person must be an engineer. He had a template where he grades the khatib. I'm sorry. And he gives different points for different things. And so that particular khutbah, apparently, my husband scored a 9 out of 10. And he was like, I've never given a 9 out of 10. I was like, what did you do in this khutbah? But more importantly, what is he doing? What is somebody who hasn't trained or studied anything doing, kind of like grading your khutbah? SubhanAllah, it's really interesting. I mean, feedback is good. We always take feedback and healthy criticism, but it's the negative. It's the every time. Sheikh, Imam, and then it's like this whole barrage of like unfounded, right? And it's kind of like, in my opinion, you should have said, and it's like, dude, you haven't studied, you know what I mean? It's a little bit hard, even though we take whatever criticism to be able to benefit, but eventually you do wear down, burnout, wear down. And then these expectations where you're expected to meet all of the needs of the congregation, including neatly put shoes in the hot water in the bathroom, right? And so you will eventually burn out. And this word, as was mentioned earlier, is a heavy word, but it is the kind of thing where overwhelmingness, the feeling of being overwhelmed, can actually definitely lead to burnout, even if it's a good thing. So burnout in da'wah is absolutely this larger system, because it's not just you're working at home and then you clock in and clock out. It's, working at the masjid and then you clock in and clock out. There's also the home life, the personal life, and all the people in it as well. So you have a emotional, physical, mental, spiritual wellness to kind of take into account. And when you don't have that, when you don't have the support, like the Imam who mentioned, a board member will come around and kind of like almost like tear down everything that you had been working on. And these board members change from year to year. The interesting thing is the level of perception of support turned out to be one of the highest things that we found in our studies on Imams. That if they perceived that they had support, they were more likely to sustain the ability to keep going. And in the Christian community, I was mentioning about the priests and pastors, their work expectancy, not their life expectancy, but their work expectancy of how long they can maintain that position as a priest burnout is within 10 to 15 years. It's very short because of how intense this role actually is. So imagine for those of you who are lifetime imams, it's a lot. And sometimes we don't even realize how much we're carrying. So what does support look like? It could be feelings of acceptance, but it could also be independence, given a certain level of autonomy to do things. Or interdependence, where you have different people assigned for different things. You're the youth director, and you're going to be in charge of education, and you're in charge of this, and you're in charge of this. Could really be helpful. So is things like this. I don't know how many of you had to really push hard to take the time off to come to something like AMJA. This sometimes is not even possible for many people. It's like, no, we pay your salary to be here 24/7, right? But even the idea of every field, the medical field, for example, they won't renew our license unless we actually do continuing medical education, right, CME. And so where is the continuing imam education, right, beyond the initial years of studying in their original system of study? And so this concept is really hard, but when you have an organization that says, we want you to grow, go take the mental health learning, right, go take the next training, it really makes a difference in how well a person is able to maintain the job that they're doing. And then not just perceived support, but actual support. So the time off, equitable pay, supportive policies, and so on. And you see this. You can see this in, it's like, where's Imam so-and-so? Oh, he's on vacation. Well, that's a good thing. Like Imams and their families need the vacation time. But you'd be amazed how many masajid and Islamic institutions, including nonprofits, don't even have a vacation policy in their employee handbook, if they even have an employee handbook in the first place, right? And so these are all things I know I'm literally, the Christian terminology is preaching to the choir, like I know I'm preaching to the choir, but I think it's important to think about these things because they are things that need to be asked for and even insisted on. And then for anybody who's in a supportive position in the masajid should be heavily working towards these things, inshallah ta'ala. Now, you had mentioned something earlier about burnout isn't just physical, not even just mental or emotional. It can also be spiritual. And nobody really thinks about this for imams, but imams, ustadas too, can go through spiritual crisis. Absolutely. One of my teachers would say, even good things, but as long as you're so pressured all the time, even good things can wear down the very fabric of your iman. And you're giving so much support to others, right? But you're not filling your cup back. And you can't pour from an empty cup, right? فَاقَدُ الشَّيْء لَا يَعْطِي, right? Like you can't give what you don't have. And so when you keep pouring and pouring and pouring out, but you're not taking in, you end up with this increased emotional exhaustion, increased negative feelings towards the work, reduced professional productivity. People start to get more unprofessional, right? And the feelings of joy, contentment go down, and the feelings of irritability and fatigue go up. Even compassion fatigue. You hear so many stories, as we do in the mental health profession, you do as well. You hear so many stories that are just heartbreaking and hard. Every day, subhanAllah. So how do you keep yourself doing okay? That's where we're going, inshallah. Because if it's untreated and unaddressed, all the things that were talked about earlier, Dr. Ahmad, depression, anxiety, feelings of hopelessness or helplessness, and then disruptions of relationships. I don't have the stats for imams. I don't know that the study has been done yet, but we have the stats for the priests, those who get married from the Christian denominations that do get married. The stats for divorce there are higher than the typical average. And so that's really telling because it's such intense amount of giving to the community and not quite enough reserve left to bring it home, right? And to deal with the home life. So disruption of relationships is a very real thing. And then you might find this strange, but it's real, the disconnection from faith and spirituality. Because it's a lot of, you find yourself even kind of feeling sometimes fake or false. And you forgive me, again, I mentioned I'm in the realm of, in the woman's world of the deen, right, realm. And my husband's in this realm too. So we're constantly seeing this in our household and in our community. Like it's this concept of, you know, are we being fake? Like, are we ourselves getting up at the very start of Fajr? Do we get up for the tahajjud? All the beautiful things that we say in our khutbahs and our lectures, are we ourselves doing it, right? And so there's almost like this disconnect. And after a while, you start to think about, you know, what am I saying? What am I doing here anymore? Like, am I really kind of like fulfilling what I'm supposed to be? Or is it just nice sounding talk? So that level of disconnectedness is a very real thing. And then dissatisfaction with this field of dawah work. And some leave it, of course. But questioning the purpose of it is something that's very powerful, where a person gets to a point and they say, why am I even doing this work? Is it even worth it? So here's a thing, because I'm going to get to kind of lay out all the difficult things and then get to some of the solutions, I hope, inshallah. Before I start the solutions part, I wanted to introduce this term to you if you're not familiar with it. It's a term called spiritual bypassing. And it's a defense mechanism in which you use spiritual or religious ideas or practices to avoid facing unresolved emotional or psychological wounds. So this is all that spiritual talk where you put on those rose-colored glasses and you use a lot of religious language of everything, khair inshallah, alhamdulillah, fatabarakallah, everything's good, everything's fine. But it's actually not. Things are not actually okay, and they're not actually fine. And you can do this within yourself or with others, but some very complex emotions like anger, sadness, confusion, guilt, right, happen, and a person just sort of like glosses over. And I'm not saying that there isn't a place for tawakkul, of course, but our deen, as you know, is a tie your camel, and then it's a aqilha wa tawakkul, right? It's a two-part. Yeah? So we do both things. But sometimes people just go straight to the tawakkul, and they're not actually doing any of the tying their own camel. And so here what we're saying is it's very important that you have both happen, because otherwise it's all this religious, spiritual sounding talk, when in reality underneath there's something festering underneath that's not actually healed. A wound that's still open and festering. So here we really think about the importance of not doing spiritual bypassing, of saying, yes, I had a loss and I never actually recovered. I had a trauma and I never fully processed it. And now I need to do that so that I can heal. And with Allah subhanahu wa ta'ala's support and help, I will do so. Right? So still using the spiritual frame, but not using the spiritual frame to put as a band-aid over something that's really a big wound underneath. Does that all make sense so far? So these are the questions I'd like you to take a moment and ask yourself. There's 3 questions here, if you don't mind doing this, inshallah. And I want you to ask, you don't have to say this out loud, but just please ask yourself, how often are these following 3 statements true for the last year? For the last year. Number 1, I feel less enthusiastic about my work than before. Number 2, I've become more insensitive towards people recently. Or I have become more callous over time in my current role. And then number 3 is, I can't remember why I wanted to become an imam. If you have answered any one of these, you might wonder, what is it mapping to? So it's mapping to, there's 3 dimensions of burnout. And we said earlier, burnout sounds like a big word, so let's break it down. There's 3 parts to burnout: depersonalization, emotional exhaustion, and reduced sense of purpose. If you answered, I feel less enthusiastic about my work than before, it could mean a possible emotional exhaustion. If you answered, I've become more insensitive towards people, it could be depersonalization. And if you answered, I can't remember why I wanted to become an imam, it could be a loss of a sense of purpose. So now I'm just going to ask, and nobody has to respond, but if you feel like this clicks, something clicks for you about this, now I'd like you to go back to that original question I asked you about burnout and see, where are you actually at? Okay. So now do we understand why this wasn't such a big word after all? The reality is I actually find that a lot of our imams truly are burnt out. Yeah. Not everybody. It could be you have a third or a 2/3 or maybe all three. But the point being, the reason I put this in a very kind of more scientific kind of explanation and broke it down is because, yeah, the word sounds like, oh, no, that's not me. But then when you look at it very closely, you realize actually some aspects of this could be me. And I can't keep pouring out of an empty cup. So what to do, right? So this is the next part of our discussion, and I hope, inshallah, we can collaboratively start to figure this out. So if we decided that at least some of you in this room have full-fledged burnout, or some of you have a third burnout or 2/3 burnout, what happens next? Number one, the concept of resiliency. And resiliency comes on multiple levels. There's a psychological and emotional. There's also spiritual. And the way the APA, the American Psychological Association, describes or defines resiliency, they say resilience is the ability to rebound from trauma or stress quickly and return to your normal state of being. This means that a person may have wellness strategies or self-care strategies or family and community support so they're able to bounce back. It's kind of like the image that Dr. Ahmad put up earlier, where he shows two children, right, who had genetic and had other issues, but then depending on how it happened, if they had support and family care and so on, they were able to actually, one had anxiety and one didn't. It's very similar here, depending on what you have available to you. Some people don't have a supportive masjid board, but they have an excellent family support system. Some people have the opposite true, and so on and so forth. For spiritual resiliency, they mean that there's a perspective and a grounding in the faith and a personal religious practice. Maybe a person has their own personal practice. Maybe they have a wird that they read every day, or they do something that they see their own shuyukh and they visit consistently. Our teachers would not allow us to continue teaching, for example, unless we ourselves are being taught. So until today, I wake up for my halakas every week, because I wouldn't dare actually put myself in a place of teaching without having a teacher. And I think along the way, we sometimes become big imams and we kind of lose the connection to our own teachers. And that is powerful, because not only it's not just a ilm-based connection, our deen is one of teacher-student relationship. It's not ilm-based only, it's also tarbiyah. And it's also a checks and balances system. And it's somebody spiritually wiser than us to say, I think you need to take a break, or I think you need to work on this more. And I know I'm, again, preaching to the choir here, but it's, remind the believers, because reminders are important, right? And one way that I would very much encourage is finding that group, and if it can't be a teacher, or maybe your teachers have passed or so on, is finding the suhbah, right? Finding the connectedness, and mashallah, this is a great room here to find that suhbah in, of just keeping people spiritually accountable to each other. It helps a lot, kind of this concept of a spiritual community. Any questions on what the resiliency means, or what this all means, this particular slide? So how do you build the resiliency? What are the practical ways? That's the theory. What's the practical? So in the practical, let's take it from an Islamic kind of point of view. We start everything with the niyyah. Every ibadah starts with niyyah, right? Intention. So connecting to the greater why. Why did I go into da'wah work? What keeps me going? How has my why changed? And if so, how? Or has my why changed? This is helpful. And if you can do this for yourself, alhamdulillah, some people are very self-reflective. Some people need the extra support of maybe that suhbah I was talking about. And for others, this is precisely the kind of work I personally do in therapy. I mean, this is exactly what you do with somebody who's coming from an Islamic frame of therapy. It's asking exactly these questions. Let's try to reorient the niyyah again, right? Let's try to figure out where is something missing and what can help it. Another aspect is shukr, right? The concept of fostering gratitude. Regular gratitude practice is known to have a positive effect, right? This is kind of the medical literature. But honestly, this concept is so part and parcel of our deen, right? Like this concept of the constant regular shukr. And for many people, it's life is so busy and work is so busy, taking time aside to do the shukr literally means carving out time for yourself, right? And I'll come to this in a different slide later, but it's really important. I feel really, it's hard. It's hard to speak to all of you, knowing that I'm in the same majal as all of you, right, in the domain, and to know that I would not say this to you if I didn't have my own regular kind of, see, women can do i'tikaf at home, so I have my own regular home i'tikaf process program. And if you do this for yourselves in your own way, whether it's an i'tikaf or uzla or a khalwa or whatever you do, that just takes some time alone and away to be able to foster this constant form of gratitude and shukr, helps intensely. Third, know thyself, and what they mean by this is where that counseling that I was referring to earlier can be very helpful. Knowing and understanding your own triggers and negative thoughts. How do I feel disconnected from God and my dawah? What experiences are hard to think about? Where does shame or fear or anger impact my dawah or personal life? Left alone, we probably wouldn't answer these questions as easily. There's always an exception. There's always somebody who's very self-reflective and they do this all the time for themselves. But often it requires sitting with somebody else to do this work. So this could be, again, a spiritual teacher and mentor, or it could be a Islamic counselor. I mean, it depends on who you have access to. But these kind of questions are very important. They really do build that kind of bandwidth and refill the gas tank. And then fiercely guarding your inner and outer rest. So I mentioned retreat already, the concept of a spiritual retreat. Taking days off every week is very important. You'd be amazed how many times Imams say, I work 7 days a week, 7 days a week. And it's almost like there's a difficulty of even advocating for oneself because the job itself is already tenuous. Like you're worried about, can you keep this job or not? So advocating for the day off or the vacation days off is actually very hard for many, many people in this position. There is a vulnerability in being the community imam. Even a sabbatical, subhanAllah. In our profession as a professor, they insist that every 5 years, minimum to more, you have to take a sabbatical from teaching, from just being constantly with students, constantly. And they want you to go and take off, go do something. And whether it's academic, you're reading something, you're writing something, or even just going to a different university to change the environment for a little while. So I realize I'm saying this and people are like, what imam has sabbaticals? I know, mashallah. But these are things as I think about how to make this profession more sustainable, how to make this a better profession moving forward for all of you. And if this is not your case right now, one day, inshallah, you're going to be in more senior positions where you can advocate for younger and junior imams. I hope it comes to you first, but if you can't, at least thinking about how to actually make this more possible for the people after you, inshallah ta'ala. I'm going to pause. There's more to share, but I want to just pause for a minute because I want to make sure that you're still with me and you're not like, yeah, okay, that's nice, but not realistic. Is there any part of this that does sound like it could be a realistic or that you could actually take back to your masajid? Yes? All of it? Allah barik fik. I'm glad to hear that. Alhamdulillah. Yes, it depends on the board. Absolutely. Yes. Do you want to bring the Shura members here? I agree. No. Oh, back in the slide on depersonalization? Sure. I'm just going to repeat what you said in case everybody didn't quite hear. It's a beautiful practice that you're saying that you use, that you're taught from a teacher, to write 3 things or to say to yourself 3 things that you have shukr for every single night. And over time, the 3 becomes much, much more. MashaAllah. The depersonalization was referring to when a person feels like people describe it in different ways, but one way it's described is it's almost like you're floating above yourself and you're seeing everything kind of underneath and you don't feel like you're part of within your own body or self. And this, like you're depersonalized from essentially from yourself, is one way of explaining it, where a person is kind of going through the motions, but they're not really fully there. They start to disconnect in that way. Yeah. Yes, clarification, question? That's wonderful. Yeah, let me also say, when you say think to yourself that the Prophet ﷺ sustained all of the difficulties that came to him and abuse, like frank abuse, right? But also all the difficulties that came his way. My flip side of the coin is to ask, what happened, what else did the Prophet ﷺ do to sustain himself? And so we know, for example, the concept of, I'll go back to the concept of khalwa, for example, or i'tikaf. And i'tikaf, as the official ibadah form of i'tikaf in the masjid, is something that he ﷺ did not just from Ramadan to Ramadan. He actually did this every week. He had certain days of the week, Laylatul Jum'ah, for example, or parts of the day, between from Fajr until the sun rose, or between Maghrib and Isha, or so on and so forth. But even before Nubuwah, he had Ghar Hira, right? Like he knew something heavy was coming, and he dealt with it by, it says in the Sirah, the closer the message was coming, he didn't know, subhanAllah, but as it was coming closer, the longer and longer and longer periods he would spend in Ghar Hira. And so that concept of this is the prophetic model. If we want to, be able to sustain and deal with everything he dealt with, we also need to use the practices he came to us with. Does that make sense? Sallallahu Alaihi Wasallam. So I hope that that's things to think about here, inshallah. This is not exhaustive. There's probably 10 more after this. There's more coming, inshallah. But yeah, no, it's a very important point. Okay, there's lots of hands and I don't know who went first. Yeah. Alayhi salatu wasalam. Where did he have his own i'tikaf that he was doing? What do you mean, where did he go after the revelation? Yes, in his home. Yes. The sisters are all saying, oh, mashallah. But for real, no, thank you. I appreciate you saying that. Assuming that the wife is willing to listen. Yes. Sure. Allahu Akbar. I think there's some difference of opinion, but Allahu Akbar. Okay, there's a few hands here. Tafadhal. Yes. Yep, you would hope that they had signed up for this journey too, but it might be hard, right? Or you may have, come to the journey at different points in your life, subhanAllah. But one thing that I will say, that I will take a couple minutes to talk about is that, I very much appreciate the idea of taking it to your family, but we have to also understand that every family is different, every wife is different, children are different. In fact, if anything, please don't be upset with me, but if anything, we find that actually it's the shuyukh's kids that are having the worst time. Not always, alhamdulillah. You have to really, really guard with Assalamu. We have to. Of course, everything. Yeah, dua is close, inshallah. So inshallah. I'll just say this, just back to your question, and I don't mean to make us all feel bad or guilty at all, abadan. That's really not the goal. And this is, I shared with you my own family for this reason. This is our personal struggle too. The reason I say that is we're very guarded because we know that that's the effect. Because there's so much, work to others that there's a lack of work inside. And so it's the problems being brought in, but not the nurturance and the smiles and the care that's happening outside. What's being brought in the home sometimes is the low battery that can't really give anymore. And the kids and wife absolutely pick up on that, 100%. In fact, if anything, they're usually very resentful of this profession, right? And if you ask them, oh, do you want to be an imam one day? I'm speaking to one right here who's, mashallah, you became an imam just like your father, may Allah bless you. But so many times we ask, the children of the imams are like, and sometimes it's not that they have an issue with the work, it's that they saw how hard you worked and how hard you were worked, and they don't want to have to repeat that again. So just how do you guard that? How do you guard all of that? I think the first thing is acknowledgement. The first thing is acknowledgement, even realizing. Sometimes people are in complete denial that this is even an issue, right? Then secondly, after acknowledgement is what do you do about it? So there's a lot of like guards to put in place to make sure that there is time reserved, that there are vacation days, that there's things that they are feeling that they are benefiting, not just giving also. Do you know what I mean? And that they're seen and heard, just like your community members are seen and heard. Yes, they absolutely need their own teachers. I hope you don't think that you're going to be the imam of your wife, mashallah, because it doesn't work. It doesn't work very well. If she has her own teachers and her own spiritual network, that's going to be a lot stronger and much better in the long run, inshallah. So let me keep moving the pace, inshallah, because we have more things to discuss. But I wanted to kind of bring us back to a couple of practical steps, inshallah. Self-care, like I mentioned earlier today, is not selfish. When we say self-care, we're coming from a prophetic model of understanding. And this, again, I'll say this, this is a different narration from this time Sunan Abi Dawud of the same concept. Verily, your own self has a right over you, so fast and break your fast, pray and sleep. This concept of you have to balance things. So here, this is intentional practice of prioritizing and nurturing your own well-being. As imams, we often neglect our own needs because of the focus on other people. But taking care of ourselves is crucial for maintaining that physical, emotional, and spiritual support to be able to support everyone else around you effectively. And this, again, sounds a lot easier said than done. However, the intentionality behind it, like actually making an intentional practice, is very important. So what I said earlier was I don't know how you all think about this, but I feel this is very important. I see the difference in my life. And every so often, even with my husband, every so often I'm like, go back to your teachers, go back to your teachers, because it's very important, and go back to your friends, the suhbah that you have of people around you, the network, that you are like-minded, where you can, for lack of a better word, the English phrase of this is let your hair down, right? As opposed to you are, you have to always perform or kind of have this performance looking when you are the imam of the community. But there are some friends that you're able to, okay, I'm saying this because one of our local people, mashallah, I completely didn't recognize him one day. I don't know, in Costco, who knows. And he had a Hawaiian shirt on. And assalamu alaikum, and I'm just looking at him like, alaikum assalam, I have no idea, because he wasn't in his typical kind of look, right? It took me a while. I was like, oh, that's so-and-so. But it was great. He was in his Hawaiian shirt. He had his hair down, mashallah. But the point is, so often we're in this performance role all the time, right? And so it's important to be able to break from that every so often and find the people that you can spend some time with. And I think maybe this weekend hopefully was a little bit rejuvenating in that way, maybe, inshallah. This is just a kind of a concept that's showing that you have both Islamic concepts, but also other concepts. So we have the dua and the Quran and so on. But then what you said earlier about driving, right? Immediately it brought me to this picture, this image of nature. And maybe it's, for some it'll be driving, for some people it'll be walking, but nature therapy. The whole time of the pandemic, one of our teachers kept saying, go out and touch the leaves, touch the trees. And we were like, break out of the virtual bubble, because we were in this lockdown situation, right? The importance of being able to head out there and kind of burst the bubble of what seems like this false reality that we're all in. Sleeping, somebody said sleep and go to sleep immediately. Allah bless you. MashaAllah. Exercising, another one of the issues that are very, very difficult for so many, because they're so constantly giving to everyone else, there isn't enough for themselves. And socializing. So here, this is how I'd like to end this section. There's 3 parts that I hope are practical: reflect, release, recharge. And here, when you think about reflect, think about what Islam taught us about connecting to our emotions and expressing gratitude. So you mentioned a beautiful practice of at least three forms of things to give shukr for every day, and incorporating that self-reflection into our practice. To me, I don't know how to get this done, to be very honest with you. I don't know how to get this done unless I'm in that kind of khalwa space, or that i'tikaf space. And because I'm able to do this as a woman at home, it's very helpful, to kind of, I just have my prayer rug area, and I tell all the sisters when I'm teaching them, use your 5 daily prayers to intend i'tikaf at home, right? Nawaitu i'tikaf, hada masjidi, and you go into your little space. And after you pray your prayers, spend some time doing your dhikr and doing your contemplative meditation, your tadabbur and your tafakkur, right? And you really give your shukr and your hamd and so on and so forth. But unless you purposefully do that exercise, it doesn't happen naturally in the day. Can I give you one more example? Something one of our spiritual teachers said, but how many of you have had a little kid running around that kind of bumps on the side of a table or something and just barely misses, completely like injuring their eye? So many times, right? We've seen this so many times. And do you know what protected that child? Of course, Allah subhanahu wa ta'ala, but what physically protected that child? Beyond the supernatural, what on their body? Their head? What part of the head? Eyelashes. You're close. You're very close. What do we call this in Arabic? The hajib. Why do they call this the hajib? Yuhshab, right? There's a hijab. There's a protection. Yes, from the shams. Yes, from the sun, but also from all kinds of corners and things. It's amazing. And so one day she says to us in the middle of a class, it really caught me off guard. That's why I'm sharing it with you. She said, "Have you ever given shukr to Allah subhanahu wa ta'ala for your hajib?" It's like, what? Like, I never even think to like say specific shukr for the hajib, or the tongue, for example, and all of the taste buds that are on it, and so on and so forth. I'm not going to a whole spiritual lesson right now, but I mean to say, like, if you don't specifically take time aside to give your shukr, it doesn't really happen. And then it occurred to me, wow, I've never given shukr for my tongue. Like whoever, like my taste buds, that's never happened before, you know? But if you do this exercise, suddenly you really do realize how big Allah subhanahu wa ta'ala is and how small we are. But also other things that seem really, really, really big start to shrink down to normal size again. And I think that's the practice, the idea of this practice. So encouraging this daily reflection through worship, dua, istighfar, even community discussions, circles of knowledge are very important. And we can't just tell other people to do this, we ourselves need this as well. The release part of this has to do with finding solace in the Islamic teachings, like in forgiveness or in embracing the tawbah and healing. And so it's amazing too how many people and students of knowledge that I interact with where they're saying beautiful things in the masjid and on the minbar and in their classes, but in their own personal practice, it's very lacking. It's very lacking. And a lot of it's time. It's not that they don't want to or they don't know they have to. It's just literally time. But everything that we want to fit in can be fit in with a process of carving the time. And then the recharging has to do with where does the concept of self-care and recharge come from in Islam? And of course, you have your 5 daily prayers that Allah asks us to pause and restart, right? And repause and restart and restart. So prioritizing that, but also finding these times of that inner peace or tranquility. And the people who you find who are the most grounded, as busy and as hectic as their life is, they're taking the time to recharge. And I think that's an important thing. Again, all of this I think is probably self-evident and nothing new that I'm necessarily sharing, but sometimes it's just good to reiterate these concepts. So far, so good? Yeah? So with that, I'm going to pause. I know we already took a lot of questions and we want to get to the next part of the conversation here. But is there anything that I can help clarify on, as a clarification on this last part? Yes. Oh, sure. Yes, it'll come up actually right here in the next section, inshallah. I think your idea of having, even if there's that the Imam is friends of everybody, but doesn't have their own friend, I can't encourage it enough. And you'd be amazed that even in the women's world of teaching, and it's the same thing. You think women are much more socializing, but actually it's the same thing when you're a deen teacher in the women's world. It's the same concept. So I understand where you're coming from. And this is where I would hope that you're exchanging each other's information and contact and staying in touch. Because whether it's in your own city or whether it's literally across the country, because now everything can be, connected virtually and by phone and such, to really find those suhbahs, right, where you're able to really spend time and even do debriefs on specific cases and such, and like little councils of imams. I really hope that this is something that you're already doing, and if not, that you're tapping into, inshallah ta'ala.
Sunnah. Yeah, I was just looking and trying to get the reactions, from the room. I think there is a, I'm not an imam, but I am a guy, and guys, we don't really have friends, like particularly if you have a specialized role in the community. And I really appreciate that comment, and I think it resonates with a lot of brothers. I think you're right. It's a similar challenge for the women, but the women, they are endowed, mashallah, with social skills and a desire to have those social connections. Whereas the men, I have many examples where people are basically lonely all the time, and like there's no one to really talk to unless you intentionally go and structure it somehow. You have a gathering or have a way where you can debrief with someone, or have an interest that maybe has nothing to do with your job role. It's just something you're interested in, and find people there who have similar interests, and you can at least have conversations. You have a time to just, relax and not necessarily have the persona on in that moment. So I think, I get a lot of imams who come to me for counseling or just debriefing things, and it's also benefit, a mutual benefit. So I think, and also the physical activity is something really important too. But there's people, we just don't see each other, and like I saw Ahmed, and I just hugged him, and there's like it's just pure love of people that we don't see much and we don't interact with. Like unfortunately, I think there's an issue that we have to be cognizant about, which is we're not having that social support as much as we would like to.